She was wearing scrubs and soft-soled shoes when he decided she was nothing. Derek Lawson had a badge, a gun, and 20 witnesses, and he used all three like weapons. He stood in the middle of Riverside Memorial's emergency room and told Emily Carter she was incompetent, reckless, and lucky she still had a job. He said it loud enough for the whole floor to hear. Emily didn't flinch. She didn't raise her voice. She just looked at him with those flat, steady eyes and said, "You have no idea who you're talking to." Derek laughed. The nurses looked away. Nobody in that room knew what she had done in places that don't appear on any map. Nobody knew what was coming. If this story already has you hooked, subscribe and follow along to the very end, because what happens next will leave you breathless. Hit like, drop a comment with the city or country where you're watching from. I want to see how far this story travels. Now let's get into it. The morning started the way most Mondays did at Riverside Memorial, short-staffed, overcapacity, and held together by bad coffee and muscle memory. Emily Carter clocked in at 6:47 a.m., 13 minutes before her shift technically began. Not because she was eager. It was habit, the kind that had been ground into her years before she ever set foot in a civilian hospital. She pulled her dark hair back without looking in the mirror, tucked her badge into her breast pocket, and walked the ER floor with the quiet efficiency of someone who had already done 100 things before most people finished breakfast. The Fairmont ER on a Monday was controlled chaos. 7 patients in the waiting area, 2 already flagged critical, 1 man asleep in a chair who had been there since Saturday and whom nobody had the heart to move. Emily passed the nursing station and picked up the handoff notes from the night shift without being asked. "Bed 4 is a chest pain waiting on the echo results," said Marcus Webb, the night charge nurse, barely looking up from his charting. He was 38, had the permanent look of a man running on fumes, and wore his exhaustion like a badge. "Bed 7's a 19-year-old with a broken wrist. Parents are livid, want to talk to someone with a medical degree. You know, not just a nurse." He said it without thinking. Not meanly, just matter-of-factly, the way people said things when they'd stopped noticing how they sounded. Emily took the chart. "I'll handle it." "I told them they had to wait for Dr. Holt." "I'll handle it," she said again, and moved toward bed 7. The parents were already standing when she pushed through the curtain, a man in a collared shirt and his wife with her arms crossed and her jaw tight. The daughter, the 19-year-old, sat on the bed looking mortified in the way teenagers look when their parents are being a problem in public. "Finally," the father started. "We've been here 4 hours. Her wrist could be—" "Displaced fracture of the distal radius," Emily said, not unkindly, pulling on gloves. "Based on what I can see in the X-ray from 2 hours ago. We're waiting on the attending to confirm treatment, but I can tell you right now, it's clean, it's manageable, and she's not in danger." She looked at the daughter. "You're in pain, though. On a scale of 1 to 10? "Like a 5, the girl said quietly. "Feels like a 7. I'll get you something." She looked back at the parents. "Dr. Holt will be with you before 9. I know the wait is hard. I'm sorry it's been this long." The father blinked, deflated in the way people get when they're ready for a fight and the other person doesn't give them one. "Okay, thank you." Emily was already moving. That was how she worked. Not loud, not seeking credit. She moved through the department like water finding the fastest path downhill, efficient, unhurried, invisible in the way that only very competent people can be invisible in a busy room. Her colleagues knew she was good. A few of them knew she was excellent, but nobody at Riverside Memorial knew much about where she'd come from because Emily didn't talk about it. When people asked about her background, she said military, and let the silence after it do the work. She'd been here 2 years. She had a studio apartment 12 minutes away, and a cat named Rook, and a standing arrangement with the Thai place on Callaway Street. She ran 3 miles every morning before most of the city was awake, and she slept badly in the way that some people sleep badly for reasons that don't have easy names. She was good at her job in a way that made people comfortable, which was different from good in a way that made people notice. She preferred it that way. At 8:20 a.m., the ambulance bay doors opened and 2 paramedics wheeled in a man in handcuffs. He was conscious, but barely. Laceration on the forearm, probable concussion, shirt soaked through with blood. He was handcuffed to the gurney, which was unusual, and behind him came the officer who'd ridden in with him. Derek Lawson walked into the ER the way certain people walk into rooms they've decided belong to them. I was tall, mid-40s, with a face built for authority, square jaw, short-clipped gray at his temples, the kind of posture that came from 20 years of people stepping aside when he entered. His uniform was pressed. His expression said he was already irritated before anything had happened to irritate him. Emily was at the intake desk when he came in. She looked up, assessed him the way she assessed every incoming situation, quickly, without drama, and looked back down at the chart in her hands. "I need someone to clear my suspect," he said to the room in general. "Someone will be right with you," said Jenna at the desk, without looking up. "I don't have time for someone." He walked to the desk and planted both hands on the counter. "He needs to be cleared for processing. You understand? I've got a custody deadline." Emily set the chart down and moved to the gurney. She checked the suspect's pupils, pulse, the laceration on his arm. The wound was deep, but not arterial. The man's eyes were unfocused, moving slowly. She put 2 fingers to his neck and counted. "He's got a probable concussion," she said. "He needs imaging before he goes anywhere." Imaging. Lawson turned the word over like it was something stuck to his shoe. "How long?" "Depends on the queue. Hour minimum, possibly 2. "That's not going to work." "I understand," Emily said, "but he can't be processed until he's medically cleared. That's the protocol." "I'm aware of the protocol." Lawson's voice dropped half a register, the kind of subtle shift that was meant to signal where the conversation was going. "What I'm asking is whether there's a faster way to move this forward." "Not safely." He looked at her for the first time, really looked, in that assessing way people do when they're deciding how much trouble something is worth. His eyes moved to her badge, to her scrubs, to her face. "And you are?" "Emily Carter, ER nurse." Something shifted in his expression. It wasn't contempt exactly. It was something flatter and more dismissive, the look of someone crossing an item off a list. She wasn't a doctor. She wasn't a threat. She wasn't worth adjusting his posture for. "Carter," he said. "Get me Dr. whoever is in charge." "Dr. Holt is with a critical patient. I want the doctor." "He won't be available for at least—" "I said I want the doctor." The words came out like they were bitten off. A few people at the nursing station looked up. Emily held his gaze without expression. "I'll let him know," she said. She was already turning away when Lawson spoke again, louder this time, in the way of a man who needed the room to understand where the authority lived. "Do you people have any idea what it takes to get a critical arrest off the street? We ran a 6-hour operation. My suspect has a custody window, and I'm standing here being told to wait in line by a nurse." The word landed like he meant it to. Not a description. A diminishment. Nobody said anything. Jenna found something urgent on her computer screen. Marcus became very interested in his chart. Emily turned back slowly. "You're waiting in line," she said, "because the man on that gurney needs medical care before he goes to a cell. That's not a bureaucratic inconvenience. That's what this place is for." A pause. "Sir." It was the pause before the "sir" that did it. Lawson's jaw tightened. He stepped forward, not aggressively, but deliberately, the step of someone recalibrating how serious they needed to be. "Let me be very clear with you," he said, voice now low enough that it was only for her. "I've been on the job for 19 years. I know how hospitals work. I know how nurses work. You follow orders, you document, and you stay in your lane. You don't lecture me on protocol in front of my custody." "I wasn't lecturing," Emily said. "I was explaining." "Then explain faster and get me the doctor." "I already said I'd tell him you're waiting." "And while you're at it," Lawson continued, and now his voice rose again, loud enough for the floor to catch it. "I want to know who cleared that laceration in triage, because whoever bandaged him before transport did it wrong. He's already seeping through, and if he loses significant blood because someone didn't know what they were doing, that is a liability issue for this hospital. I'll make sure the administration hears about it." Emily looked at the bandage. She looked at it for exactly 2 seconds. "That bandage was applied on scene by paramedics," she said. "It's field dressing. It was appropriate for transport. The seeping you're seeing is normal given the depth of the wound. I'll dress it properly now." So you admit the care was inadequate?" "That's not what I said." "You said it needed to be done properly. That implies it wasn't done properly." Emily stopped. She had learned, a long time ago and in places with much higher stakes than this, how to read the moment when someone decided to stop having a conversation and start performing one. This was that moment. Lawson wasn't interested in the bandage. He was interested in establishing that someone here had made a mistake, and she was the one standing in front of him. "Officer Lawson," she said quietly, "I'm going to dress this wound, and when Dr. Holt is available, I'll make sure he speaks with you. Until then, your suspect is being cared for appropriately." She turned to the supply cart. "I wasn't finished," Lawson said. She kept moving. What happened next lasted about 45 seconds and felt much longer. Lawson crossed the floor in 3 steps, not grabbing her. He wasn't stupid enough for that, but planting himself directly in her path in a way that left very little ambiguity. "I said I wasn't finished talking to you." Emily stopped. She was still holding the dressing kit. She looked at him with those flat, still eyes that gave nothing away. Around them, the ER had gone a little quieter in the ambient, background way that a room goes quiet when people are pretending not to pay attention. "This is a working floor," she said. "And I'm an officer of the law," he said, "which means when I'm talking to someone, they stop and they listen. Do you understand how this works? I understand that you're standing between me and a patient. I understand that you think your little badge and your little title give you some kind of authority in this situation. Let me tell you something." He leaned in just slightly. "I've had nurses, good nurses, experienced nurses, referred for review because they got in the way of law enforcement doing their job. I can make your life significantly more difficult than it currently is. And right now it looks to me like you don't know what you're doing, you don't know who you're talking to, and you're about 30 seconds from having a very bad month." Emily was quiet for a moment. "You have no idea who you're talking to," she said. It came out completely level. Not defiant, not scared, not playing a game. She said it the way she might say the weather. Lawson laughed. It was a short, dismissive sound, the kind of laugh that was meant to end things. "Yeah," he said. "Okay, sweetheart." He stepped aside because he'd made his point, or thought he had, and returned to leaning against the wall near his suspect's gurney with the posture of a man who had won. Emily dressed the wound without speaking. Dr. Raymond Holt arrived 20 minutes later, apologized to Lawson with the practiced, frictionless diplomacy of a man who'd smoothed over 1,000 small explosions and moved the situation forward. Lawson got his medical clearance signed within the hour and left with his suspect in tow. He didn't look at Emily again. She finished her shift notes and moved to the next patient. By 1:00 p.m., the floor had settled into its midday rhythm. Emily was in the break room eating a granola bar she'd remembered to buy and forgotten to enjoy when Jenna came in and closed the door behind her. "He's calling the chief of nursing," Jenna said without preamble. Emily looked up. "Lawson. He filed a complaint. Says a nurse on the floor was obstructive and possibly negligent. Says the triage bandaging was substandard and that you argued with him in front of staff in his custody." Jenna was 25, 4 months out of nursing school, and had the face of someone who still believed that unfair things could be fixed if you explained them clearly enough. "You need to know." Emily set the granola bar down. Okay. That's all? What would you like me to say?" "He's lying, Emily. That bandaging was fine. You didn't do anything wrong. He just—" Jenna stopped. "He was humiliating you in front of everyone, and nobody said anything, and I should have said something and I didn't, and now he's—" "Jenna," Emily's voice was even. "It's fine. It's not fine. He called you sweetheart. He did. You're going to let him just—" "I'm going to do my job," Emily said. "That's what I'm going to do." Jenna stood there for a moment, caught between the instinct to argue and the look on Emily's face, which made arguing feel somehow beside the point. She left without saying anything else. Emily finished the granola bar. What she didn't say to Jenna, what she didn't say to anyone, was that she had been through far worse than Derek Lawson in far worse places, and that men who used their authority as a weapon were a recognizable type, a specific category, and they were almost always most dangerous when they felt completely certain of their power. She had learned to wait, not because she was passive, because she understood timing in a way that most people never needed to. She had been somewhere once where timing was the difference between everyone going home and no one going home. She didn't think about that place often. When she did, she made it brief. At 2:15 p.m., the chief of nursing, Sandra Okafor, called Emily into her office. Sandra was meticulous and fair in the specific, difficult way of someone who'd had to fight for every inch of their career. She ran the nursing department at Riverside Memorial with quiet authority and a reputation for not tolerating either incompetence or drama. She had short natural hair and reading glasses she'd push up her nose when she was thinking hard about something, and she was wearing them now. "Close the door," she said. Emily did. "Officer Lawson filed a complaint against you. Negligent triage assessment and obstructing law enforcement in the performance of his duties." Sandra laid a single sheet of paper on the desk, but didn't look at it. She looked at Emily. "Walk me through this morning." Emily walked her through it. Factually. No editorializing, no emotion, just sequence and detail. The suspect, the wound, the imaging, the conversation. When she finished, Sandra was quiet for a moment. "Did you argue with him?" "I corrected an inaccurate characterization of the triage care." "In front of the floor." "He made his complaint in front of the floor." Sandra pushed her glasses up. "The bandaging, was it actually substandard?" "No, it was field dressing appropriate to transport conditions." "You're certain?" "Yes." Sandra held her gaze, then looked down at the sheet of paper. "I wants a formal review and is threatening to loop in the city oversight board if we don't take the matter seriously." Those are his words. She paused. "Emily, do you have any documentation of the interaction? Anything recorded?" "The nursing station has overhead cameras." "I know, I'll pull them." Sandra took her glasses off. "I'm not suspending you. I'm not opening a formal review yet. I'm telling you that this is now elevated, and until it's resolved, I need you to, I don't want to say keep your head down, because that's not fair, but I need you visible, available, and doing your job without giving him any additional material to work with. Can you do that?" "Yes," Emily said. "Good." Sandra hesitated. "He outranks me in the city hierarchy. That's just a fact. If this gets political—" "It won't," Emily said. She believed it, not out of naivety, out of knowledge about how things ended when people like Lawson pushed too hard on someone they'd misjudged. She'd seen it before. Not here, not in a hospital, but she'd seen it. She went back to work. It was 4:40 p.m. when the radio call started. Emily heard it first as background noise, the dispatch frequency that the ER ran on a low channel for incoming ambulances. A voice, clipped and technical, requesting priority clearance for multiple incoming casualties. The word military was used. Then trauma protocol. Then a number. 7. 7 critical incoming. The floor changed in an instant. Charge nurse Marcus Webb was already at the radio, pen in hand, face gone still in that particular way of experienced ER staff encountering something outside the ordinary register. Emily was 3 feet away when she heard the transmission clearly. Multiple blast-related injuries, 2 with compromised airways. Requesting trauma team full activation, ETA 11 minutes. She was already moving toward the trauma bay before he finished writing the number down. "Carter," Marcus said behind her. "I heard it. We've got 2 attendings, 1 resident, and 3 nurses currently active for trauma," he said. "Holt's our primary." "Where's Vasquez?" "Left an hour ago. Kid's sick." Emily stopped at the supply cart and began pulling specific items. Not the standard preset. Different things. Her hands moved without hesitation. Hemostatic gauze, chest seals, decompression needles, things that sat on the cart untouched for months in a civilian ER. "You know blast trauma protocol?" Marcus asked, watching her. "I know it," she said. There was something in her voice that made him stop asking questions. Dr. Holt arrived in the trauma bay 40 seconds later, already gowned, with the resident Dr. Avery Park 2 steps behind him. Holt was competent, careful, good under pressure within a certain range. Emily had worked with him long enough to know his limits. She did not know yet whether tonight would find them. 7 incoming, she told him, meeting him at the bay door. At least 2 airway compromised, blast-related. If they're from the operation I think they're from, expect fragmentation patterns and possible tympanic. Where are you getting the operation intel? Holt cut in. The radio described a controlled detonation scenario. There's a training exercise running out at Barrow Field this week. I saw the notification. Holt blinked. You read base notifications? Emily didn't answer that. The ambulance bay doors opened with a crash at 4:51 p.m. What came through them was organized chaos at the speed of emergency. Gurneys moving fast, paramedics calling out stats, hands reaching and adjusting. The first patient was a man in his 30s, military build, in partial uniform, eyes open and moving fast between confused and gone. His chest was wrong, asymmetrical, moving unevenly on the right side. Emily was beside him before the gurney reached the bay wall. "Tension pneumo," she said. "We don't know that yet," Holt said, moving to the other side. Emily pulled back the shirt. The percussion note told her everything she needed to know. Diminished breath sounds, tracheal shift, neck veins standing up. "It's tension pneumo," she said. "If we wait for X-ray, he dies on the table." Holt hesitated. 1 second. That 1 second said something about the difference between knowing what to do from a textbook and knowing it from a place where hesitation had different consequences. "Do it," Holt said. Emily had the needle in the second intercostal space before he finished the word. There was the characteristic hiss of released pressure, and the man's chest began to equalize. His O2 stats, which had been dropping, steadied. The room exhaled. But there were 6 more coming through the door. The next 40 minutes at Riverside Memorial were the kind of 40 minutes that people in emergency medicine talked about for years. Not because everything went right, but because of the specific texture of what it looked like when a situation exceeded its container and somebody stepped into the gap. Dr. Holt was working the second patient, a femoral bleed that was serious and manageable. Avery Park was overwhelmed at bed 3 with a head injury and a cascade of complications she hadn't seen outside of textbooks. The nurses were moving fast, but 2 of the incoming patients had wound patterns that didn't match anything in the standard civilian trauma playbook. Emily moved between stations. She was at bed 5 when she saw the pattern on the 4th patient's abdomen, the scattered, shallow entry wounds that looked almost minor until you understood that they weren't minor at all, that they indicated internal fragmentation that was working its way toward something essential, that the clock on that patient was measured in minutes, not hours. "He needs surgical consult now," she said to the nurse managing him. "Tell them possible fragmentation, ascending colon proximity. Request CT if he's stable enough. If not, take him straight to OR. I'll call Holt. Call surgery directly. Tell them what I said. Use those words exactly." She moved to the next patient. She was doing 3 things at once in a way that looked, to anyone watching, less like a nurse improvising and more like someone executing a plan they'd already made. Because that was what it was. She had worked through scenarios like this before, not in a drill, not in a simulation. In actual forward operating environments where the lighting was bad and the supplies were limited, and the person next to you either knew what they were doing or didn't, and you knew which one it was within the first 30 seconds. She knew what she was doing, what nobody in that trauma bay knew. Not Holt, not Marcus, not any of the 3 nurses running alongside her, was that the 2 men standing just inside the ambulance bay doors were not paramedics. They were wearing civilian clothes. They'd arrived with the last ambulance, walking in quietly, staying to the edge. One was tall, late 50s, with silver at his temples and the kind of posture that had nothing to do with vanity. The other was younger, compact, watching the room with the specific, assessing calm of someone doing an evaluation. They were watching Emily Carter. The older man said nothing for several minutes. He watched her work the room. He watched her call a tension pneumothorax correctly and act on it before anyone else had gotten there. He watched her redirect a surgical consult that would have cost critical time. He watched her move to patient 6, a young soldier, barely 20, with blast injury to both lower extremities, and saw her do something with a tourniquet that the younger man beside him noted quietly under his breath. "That's TCCC," the younger man murmured. "Tactical Combat Casualty Care. Battlefield Medicine." "Yes," said the older man. "She's doing it like she's drilled it." "She has," said the older man. "More than you know." He watched Emily work for another 30 seconds, and something in his expression shifted. Not quite surprised because he had known enough to come here, but something that looked like confirmation, like finding a thing you'd hoped was still true. His name was Colonel Robert Ferris, and he had not seen Emily Carter in 4 years. He had not come to this hospital by accident. Emily didn't see him. She was at bed 6, both hands occupied, talking the young soldier through what was happening because he was conscious and scared. And when people were scared, they needed a voice to follow. "Look at me," she said. Don't look at your legs. Look at me. What's your name?" "Reyes," he managed. "Danny Reyes." "Okay, Danny Reyes, I need you to keep your eyes on my face. You're going to feel pressure." "That's correct. That's what's supposed to happen." You're going to be okay. Am I? You're going to be okay, she said again, and the way she said it was different from the way people said it to be comforting. She said it like a fact she had already verified. Stay with me. He stayed with her. At 5:34 p.m., with 6 of the 7 patients stabilized and the 7th in surgery, the controlled chaos of the trauma bay began to slow. The noise level dropped. Gloves came off. Someone sat down on a rolling stool. Emily was at the sink washing her hands when she became aware of someone standing behind her. She looked at the reflection in the window above the sink before she turned. She went still. Colonel Ferris hadn't changed. A little more gray. The same eyes, though. The kind of eyes that had seen too many things to bother pretending about what they were looking at. "Emily," he said. She turned. For a moment neither of them spoke, and in that silence was a conversation that had no words for it, the kind of silence that only existed between people who had been through something together that changed the language available to them. "Colonel," she said finally, "you just ran a combat triage protocol in a civilian ER," he said. "I ran whatever the situation required." He nodded slowly. "That's what I wanted to talk to you about." He looked around the bay, at Holt still documenting, at the nurses restocking, at the young soldier in bed 6 who was now asleep and breathing steadily. "Not here," he said, "but soon." "What happened?" she asked. "The operation. That's part of what I need to tell you." He held her gaze. "It's not over." Emily didn't ask what he meant. She understood what it meant when someone who knew her real history showed up unannounced the same day that 7 soldiers came through the ambulance doors. She understood that the evening was not going to end quietly. What she didn't know yet, what she couldn't have anticipated, was that Derek Lawson was at that same moment standing at the nursing station 30 feet away, watching her talk to a man in civilian clothes who had the unmistakable gravity of serious authority, and that something in the officer's expression had shifted from contempt to something more careful. Something that looked, if you watched closely enough, a little like the first flicker of unease. Lawson stayed where he was for another few seconds, watching Emily and the colonel with the particular stillness of a man recalculating. Then he looked away, like he'd decided it was nothing, and went back to talking to the ward clerk about his complaint paperwork. But his shoulders were different, tighter. The easy authority that had filled the room that morning had contracted into something harder and more defensive. And if you knew what to look for, and Emily, when she finally noticed him from across the floor, knew exactly what to look for. It looked like a man who had just realized he might have picked the wrong fight. She filed that away and turned back to Ferris. "You can't be vague with me," she said, keeping her voice low. "Not after today." "I'm not being vague. I'm being careful." He glanced toward the bay doors. "There are things in motion that I can't lay out in a hospital hallway. What I can tell you is that the operation that sent these men here was compromised. We had an intelligence failure 3 days ago, and we've been managing the fallout since. 2 of the men you stabilized tonight were carrying classified materials. Not physically, but in terms of what they know. Their identities are sensitive." Emily processed this without visible reaction. "And you came here specifically?" "We were tracking where they'd be transported, yes." He paused. "We also knew you worked here." "Is that a coincidence you're telling me to ignore?" "It's a coincidence I'm telling you is not one." His voice was measured. "Your record is still active, Emily. You know that. You left the unit, but you didn't leave the registry. If something like tonight happened in a facility where you were present, protocol required notification." "Notification," she repeated. "An evaluation." She understood what he meant by evaluation. It wasn't a performance review. It was the specific kind of assessment the unit ran when they were considering bringing someone back into an active operational role. She had been through one before her first deployment, before everything that came after. She knew what it looked like from the inside. "I'm not going back," she said. "I'm not asking you to go anywhere tonight." He reached into his jacket and produced a small card. No logo, just a number. He held it out. "But there are things you need to know about that operation, and some of them concern you directly. Call that number when you're off shift." Emily looked at the card. She took it. Ferris gave her one more long look, the kind of look that carried weight from years and distance and things neither of them had words for. And then he nodded once and walked toward the ambulance bay doors. The younger man followed without looking back. Emily stood at the sink for another moment, the card between 2 fingers, The noise of the ER reforming around her. Someone was asking for more gauze. Someone was on the phone with radiology. Bed 3 monitor was alarming softly, not critically. The machinery of the place kept moving, indifferent to whatever had just happened. She pocketed the card and went back to work. The complaint hit Sandra Okafor's desk in formal written form at 6:00 p.m., which was fast enough that someone had helped Lawson navigate the administrative filing process. Or he'd done this before and knew the system. Probably both. Sandra read it twice, then called Emily into the hallway just outside the break room. "He's escalated," Sandra said. She held the document but didn't hand it over. "He's now claiming that your behavior this morning constituted interference with a law enforcement operation, and he's added a secondary complaint alleging that your triage assessment of his suspect was deliberately delayed." "Deliberately," Emily said. His word. "He arrived at 8:20. His suspect was assessed within 4 minutes of intake. The imaging queue was hospital-wide, not specific to his case. I know that. The timestamp is on the chart." "I know, Emily." Sandra looked tired in the specific way of someone who knew they were right but could already feel how much work being right was going to take. "The problem is that he's looped in Lieutenant Gorman from the City Oversight Board. Gorman and the hospital administrator have a history. Political history." She said it the way people said things when they wanted you to understand without them having to spell it out. "Administrator Pruitt is not going to want this to become a public-facing issue." "So what does that mean?" "It means Pruitt is going to call me at 7:00 and ask whether there's a way to resolve this quietly. And by quietly, he will mean in a way that doesn't require the hospital to push back against a law enforcement complaint. And by that, he'll mean whether I can be moved or managed or quietly reassigned." Sandra didn't say yes. She also didn't say no. Emily stood there in the hallway for a moment, looking at nothing in particular. From inside the ER, she could hear the sound of a patient being wheeled past, a monitor alarming, someone calling out a blood pressure. The ordinary noise of the place. "Sandra," she said, "pull the camera footage from this morning. All of it. Bay cameras, hallway cameras, the intake desk angle. Pull it before the end of tonight." "I'm already planning to." "And document the triage timestamps before anyone touches the charts." "Also already doing it." Sandra paused. "Is there anything else I should know about this situation? Anything outside the complaint itself?" Emily thought about the card in her pocket, about Ferris, about what he'd said about things in motion. "Not yet," she said. Sandra gave her a look that said she'd noticed the yet, but wasn't going to push it. "Go finish your shift." At 7:15 p.m., Emily was charting at the station when she became aware of a presence to her left. She looked up. It was one of the soldiers. Not a patient. This one was ambulatory, dressed in civilian clothes that fit like they'd been borrowed, which they probably had. He was young, mid-20s, with the kind of face that was still learning what expression to wear when things got hard. His left arm was in a soft wrap from the wrist to the elbow. He moved carefully, like something in his ribs was complaining. "You Carter?" he asked. "Yes." "I'm Specialist Torres. Marco Torres." He stopped a few feet away, uncertain in the way of someone who had something to say and wasn't sure about the territory. "You're the one who worked on Danny Reyes." "I was part of the team, yes." "He's asking for you." Emily set her pen down. Torres led her back toward the medical surgical unit where the 7 soldiers had been moved after stabilization. The hallway felt different here, quieter, with 2 men in plain clothes standing near the elevator who weren't hospital staff and weren't trying to look like they were. Emily noted them and kept walking. Reyes was in a 2-bedroom, the other bed empty. He looked younger in the hospital lighting than he had in the trauma bay, like the equipment and the noise had been giving him a kind of borrowed size that was gone now. His legs were elevated, wrapped, and he was propped up against 2 pillows looking at the door like he'd been watching it for a while. "You're Carter," he said when she came in. "I am. I wasn't sure if—" He stopped, started again. "You told me I was going to be okay, when I was on the table. I remember. I've had people tell me that before," he said, "on deployment. And sometimes it was true, and sometimes it was just something you say." He looked at her carefully. "You said it different." Emily didn't have a prepared answer for that. She pulled the chair next to his bed a few inches closer and sat down without asking. "How are you feeling?" "Like someone parked a truck on my legs." He paused. Doc says I'll walk. With PT. Probably 8 months. That's a reasonable timeline for what you came in with. I know. He was quiet for a second. Where did you learn to do that? What you did in there? Torres said he said it looked like battlefield work. It was a long time ago, Emily said. But you knew. You knew what we were, what the injuries were. The patterns tell you things, if you know how to read them. He watched her. You were in? Yes. What branch? Army. Combat role? She held his gaze. Medical. He nodded slowly, processing it. Outside the room, down the hall, she could hear the low murmur of the two plainclothes men talking. The building had a different quality at night. Not quieter exactly, but differently textured. Less forward motion, more waiting. There's something going on, Reyes said, with the men who came in with us. I'm not supposed to know, but I know. Something about the op is still active. Whatever happened to us wasn't an accident. Emily kept her expression neutral. You need to rest. I know. He didn't push it. I wanted to say thank you, not in a generic way, specifically. He looked directly at her. You made a decision and you moved on it before anyone else did. That kept me alive. I wanted you to know I know that. Emily was quiet for a moment. This was always the hard part. Not the crisis, not the pressure, but the after. The moment when someone looked at you clearly and you had to decide what to do with being seen. Get some sleep specialist, she said. She was at the door when he spoke again. That officer, Reyes said, the one making noise out front earlier. Torres heard him on the phone. He's saying something about a nurse and a complaint. Emily turned. I heard what he did this morning, Reyes said. The guys in the bay were talking. He was wrong. His voice was simple and flat, the way young soldiers stated things that were factually obvious. If you need anyone to say that officially, we'll say it. She looked at him for a moment. Thank you, she said, and she meant it. And then she left before either of them had to figure out what came next. The call from Administrator Pruitt came at 7:52 p.m., not to Sandra, but to Emily directly, which was itself a signal. Pruitt didn't call floor nurses. He called department heads and administrators and occasionally physicians when something had moved high enough to require it. His voice on the phone was smooth and practiced and managed in the way of someone who had spent years making difficult things sound like reasonable suggestions. Emily, I appreciate your patience with what's been a challenging day, he said. I've reviewed Officer Lawson's complaint and spoken with Lieutenant Gorman, and I want to be clear that the hospital takes these matters very seriously. I understand, Emily said. She was standing near the vending machines at the end of the ER hallway, the only place quiet enough for a phone call. I also want to be fair to you, Pruitt continued. Your record here is solid. Marcus Webb speaks highly of you, and Dr. Holt has said the same. This isn't about your competence. What is it about? A slight pause. It's about resolution. Officer Lawson has significant political connections in Fairmont, and Lieutenant Gorman sits on the hospital board's Community Liaison Committee. A formal dispute between this institution and the police department would be, he chose his word carefully, complicated. You're asking me to drop it, Emily said. I'm asking whether there's a path forward that doesn't require the hospital to take an adversarial position with local law enforcement. His voice was perfectly calibrated. Perhaps a clarification meeting, an acknowledgement that communication this morning could have been handled more carefully on both sides. Emily stood very still in the vending machine hallway. Administrator Pruitt, she said. I documented my actions correctly. The triage timestamps are in the chart. The bandaging was performed by paramedics and was appropriate for transport. I did not interfere with law enforcement. I performed my nursing duties. A pause. If the hospital chooses to pursue a both sides resolution to a complaint that is factually without merit, I would need that decision to be made in writing by the administration, with the administrator's signature. A longer pause this time. That's a significant ask, Pruitt said. I know, Emily said pleasantly. I hope it won't be necessary. She heard him recalibrating through the silence. Let me revisit the situation and speak with Sandra again. Thank you, she said, and ended the call. She stood for a moment, then bought a terrible coffee from the machine and drank half of it before throwing it away. At 9:07 p.m., 30 minutes before the end of her shift, the situation shifted in a direction nobody had predicted. The two plainclothes men from the hallway outside Reyes's room appeared at the nursing station and asked to speak with whoever was in charge of nursing. Marcus directed them to Sandra, who had come back to the floor. Emily was finishing her final chart notes when she saw the three of them move into the conference room and close the door. 10 minutes later, Sandra came out alone and walked directly to Emily. Her expression was not the expression of someone managing a political problem anymore. It was the expression of someone who had just been told something that rearranged the furniture. "My office," she said. Emily followed her. Sandra closed the door and sat down, then seemed to reconsider sitting and stood up again. She crossed her arms. "Those two men. Who are they?" "I think you know more than I do right now," Emily said. "They showed credentials to me. Military intelligence. They said the patients from tonight's operation are part of an active sensitive matter, and that anyone involved in their care may be contacted for debrief." She looked at Emily steadily. "They also said, and this is the part I need you to explain to me, they said that you specifically were flagged as a known associate and former asset, and that your presence here tonight was not incidental to their operations." Emily sat down in the chair across from Sandra's desk. "That's complicated to explain quickly," she said. "I have time. My military background is more extensive than what's on my civilian application," Emily said. "I worked in a specialized medical role, advanced trauma, field operations. I left 4 years ago." "Left voluntarily?" "Yes. And the men tonight, the soldiers, you knew the type of injuries because you'd treated them before." "Yes." Sandra was quiet. "Is there anything you've done, or anything about your background, that would give Lawson's complaint any actual weight? Anything I need to know?" "No," Emily said. "Everything I did today was within my scope, medically and professionally. The military background is separate and classified and has nothing to do with his complaint." "Then why do I feel like there's a much larger context here that I'm standing in the middle of without a map?" "Because there probably is," Emily said honestly. "I don't have the full picture yet either." Sandra looked at her for a long time. "The men asked about the security footage, specifically the footage from this morning that shows the interaction between you and Lawson." Her voice was careful now. "They weren't asking about it in relation to your complaint. They were asking about it in relation to him." Emily went still. "They know who he is?" she asked. "They didn't say that directly. They asked whether the footage was preserved and whether it had been reviewed by administration yet." Sandra paused. "Emily, is there something about Officer Lawson specifically that connects to whatever these men are involved in?" Emily didn't answer immediately. She was moving through what she knew and what she could verify, aligning it against what Ferris had told her. Intelligence failure, compromised operation, men whose identities were sensitive. She thought about Lawson arriving this morning with his suspect, his aggressive need to rush the processing, his specific anger when she slowed things down. She thought about a custody deadline that had seemed more urgent than a standard arrest. "I don't know," she said, "but I think someone should look at who his suspect was." Sandra stared at her. "What are you saying?" "I'm saying that a man who goes to significant lengths to hurry an injured suspect through a medical clearance and then files an aggressive complaint against the nurse who slowed him down might have reasons beyond impatience." She kept her voice level. "That's not an accusation. That's a question worth asking." The silence in Sandra's office was different from the silence earlier. This one had weight. "I'm going to call the board chair," Sandra said finally. "That's your call to make." "The footage is already preserved?" "It confirmed it at 5, Emily said. "Back to the secondary server." Sandra nodded, once, like something had been decided that she hadn't quite meant to decide yet. "Go finish your shift. Don't engage with Lawson if he's still in the building. Don't engage with those men again without HR present." "Understood." Emily stood and moved to the door. She had her hand on the frame when Sandra said her name. "Carter?" She waited until Emily turned. "You should have told me more this morning about who you are." "You didn't need it this morning. I needed something." Emily thought about that. "I know," she said. "I'm sorry. It wasn't enough." And they both knew it, and neither of them had a better answer, so Emily went back to the floor. At 9:40 p.m., she was pulling on her jacket at the end of her shift when Marco Torres appeared in the hallway again. He was moving faster this time, without the careful quality he'd had earlier, and his face was doing something that Emily recognized as controlled urgency, the expression of someone who had been trained to stay calm and was spending real effort on it. "There's a problem," he said quietly. "What kind?" "The officer, Lawson, he came back. He's at the front desk. He's not alone." Torres glanced down the hallway. "He's got 2 uniforms with him, and he's saying he needs to take custody of one of our guys. Says he's reclassifying the arrest from the operation this morning, and one of the soldiers falls under his warrant." Emily stared at him. "Which soldier?" "Reyes." Everything in Emily's body went specific and sharp in the way that didn't feel like alarm but was the precursor to it. The narrowing of focus, the elimination of everything except the problem directly in front of her. "That makes no sense," she said. "Reyes came in as a casualty. He's a medical patient." "I know, but Lawson's got paper. He's showing it to the admin at the desk." "Where are the military intelligence guys?" "Gone. Left 20 minutes ago." Emily looked at the hallway, then at Torres, then made a decision in roughly the time it took to take one breath. "Go back to Reyes's room," she said. "Stay with him. Don't let anyone in without hospital security present. You're a visitor. They can't remove you from a patient room without involving hospital staff." "What are you going to do?" "Talk to someone," she said. She pulled out the card Colonel Ferris had given her, looked at the number and dialed it from the hallway phone. It rang once. "Ferris," said the voice on the other end. "It's Carter," she said. "Lawson is back at the hospital with a warrant for Reyes. You need to tell me right now how much of what you said this afternoon I should be taking seriously." There was a pause. Not long, 2 seconds, 3, but enough to confirm that what she'd just said was not news to him and that his response was not going to be simple. "Don't let them take him," Ferris said. "On what authority?" "Mine. As of 40 minutes ago, Reyes is under military jurisdiction. The transfer paperwork is in process, but it hasn't reached the precinct yet." His voice was controlled but moving fast underneath it. "Lawson is acting on a warrant that is about to be superseded. Stall him." "For how long?" 20 minutes? Maybe 30? Emily looked down the hallway toward the front desk. She could see at the far end the shape of a uniformed officer at the window. "And if I can't?" "Then a man who has information we need ends up in a cell by morning and we lose him." Ferris paused. "Emily, 20 minutes. She hung up. She straightened her jacket, picked up her badge, and walked toward the front desk with the specific kind of calm that was not the absence of urgency, but its complete compression into something that looked, from the outside, like someone who had all the time in the world. Derek Lawson turned when he heard footsteps. When he saw it was her, something moved across his face. Surprise. Then something harder than surprise. "You're off shift," he said. "I was," Emily said pleasantly. "Officer Lawson, I understand you're here about a patient." "I'm here about a detainee. It's not your concern." "Any patient in this building is my concern." She stepped to the desk and looked at the ward clerk, a young man named Patrick, who was clearly terrified. "Patrick, can you pull up the current admit status on bed 14 for me?" Patrick looked between her and Lawson and pulled up the screen. "I have a warrant," Lawson said, his voice dropping into the register she recognized from this morning. "This isn't a discussion." "I'm not trying to discuss it," Emily said, not looking at him, still looking at the screen with Patrick. "I'm trying to confirm the patient's current medical classification before any transfer can be authorized. That's standard discharge procedure. I'm sure you've dealt with it before. It doesn't apply to a law enforcement transfer. Hospital policy says it does. Sandra," she raised her voice slightly, "could you come to the front desk?" She could feel Lawson's patience compressing beside her. The 2 officers with him were younger, quieter, watching the situation with the slightly uncertain energy of people who'd expected this to be simpler. Sandra appeared from the corridor to the right, moving fast, reading the room the moment she came through the door. "Officer Lawson," she said in her smoothest administrative voice, "what can we help you with?" And as Lawson turned to Sandra and began to explain his warrant, Emily looked at the clock on the wall behind the desk. 20 minutes. She would give him 20 minutes, and in those 20 minutes, she would use every procedural friction available to her, every form, every policy, every signature requirement, to keep Danny Reyes in that room. Because something was wrong with Derek Lawson's warrant, and she didn't know yet exactly what it was, But she knew it the way she knew a tension pneumothorax before the x-ray confirmed it, the way she knew a fragmentation pattern from the entry wounds, the way she knew every time before she could prove it. The thing she was looking at was not what it was being presented as. And she had 17 minutes left to be right about that before everything in the building changed. The clock on the wall read 9:43 p.m. 17 minutes. Sandra was doing what she did best, absorbing Lawson's energy without reflecting it back, asking procedural questions in the measured tone of someone who genuinely needed the answers, buying seconds with the professional patience of a woman who had spent 20 years navigating systems designed to exhaust people into compliance. She asked about the warrant's jurisdiction classification. She asked whether the patient had been formally notified. She asked about transfer liability waivers. Each question was legitimate. Each one cost Lawson 45 seconds he didn't have, and he knew it, and the knowing made him tighter and louder, which cost him more time. Emily stayed at the edge of the conversation, close enough to be part of it, and far enough that Lawson wasn't talking to her directly. She watched the clock. She watched the two officers behind him, who were getting restless in the way of people who'd been sent somewhere simple and found it complicated. She watched Patrick at the desk, who had understood without being told that slow was the right speed right now, and was pulling up forms with the careful, methodical energy of someone who'd never moved so deliberately in his life. 11 minutes. Lawson slapped the warrant on the desk. "This is a valid legal document. You're obstructing a law enforcement action." "We're not obstructing anything," Sandra said calmly. "We're completing the discharge protocol required by hospital policy. If we transfer a patient without completing that protocol, and something happens to him in custody, the hospital is liable. I'm protecting you as much as us." "I don't need your protection." "All right. Then I need your signature acknowledging that you're accepting medical responsibility for a patient who is currently on IV antibiotics for a contaminated wound, has a soft cast requiring monitoring for compartment syndrome, and has documented pain levels requiring scheduled medication." She placed a form on the desk. "Sign here." Lawson stared at the form. He didn't sign it. He knew what signing it meant. It meant he owned whatever happened to Reyes in the next 24 hours. And whatever was going on with this warrant, Lawson was not stupid enough to own the medical consequences of a man with a contaminated wound in a police holding cell. "I need to make a call," he said. "Of course," Sandra said graciously. "Patrick, could you get Officer Lawson some water while he—" "I don't want water." Lawson pulled out his phone and moved 6 feet away, and Emily exhaled exactly as much as the situation allowed, which was not much. 8 minutes. She moved next to Sarah and spoke at the level of a breath. "His suspect from this morning, the one he brought in. Did anyone flag his intake information?" Sandra kept her eyes forward. "Not that I saw." "When Lawson processed out with him this afternoon, did he go through normal release?" "He was medically cleared. After that, it's law enforcement jurisdiction. We don't—" Sandra paused. "Why?" "Because Ferris asked me how much I knew about who that suspect was," Emily said. "And I didn't know anything. But the way Lawson is moving tonight—" She stopped. "He's not behaving like a cop executing a warrant. He's behaving like someone who is running out of time." Sandra glanced at her sideways. "You think the warrant is connected to the operation?" "I think a lot of things are connected, and I don't have enough of the picture yet." "Emily," Sandra's voice dropped another register. "If this is what you're suggesting, if there is a law enforcement officer in my hospital who is connected to the incident that put 7 soldiers in my trauma bay tonight—" "I'm not saying that. You're saying something very close to it." Emily didn't argue. She looked at the clock. 5 minutes. Lawson was still on the phone, his back partially turned, his voice too low to hear clearly. One of the officers with him caught Emily watching and looked away first, which told her something about where his confidence was. She pulled out her phone and texted Ferris a single word. 5. The response came back in under 30 seconds. Hold. She put the phone in her pocket. 3 minutes. Lawson ended his call and turned back to the desk. His face had resolved into something that was working hard to look like authority and was slightly missing it around the edges. "I'm going to need to go up to the room," he said. "Now." "I'll need to accompany you," Sandra said immediately. "That's not hospital policy. Any law enforcement access to a patient room requires nursing administration or security escort. I'll take you up myself." She looked at Emily. "Can you cover the floor for me for a few minutes?" It was not a real question. It was a choreographed exit that kept Sandra with Lawson and bought Emily a position at the front of the building where she would see whatever was coming through the door. Of course, Emily said. She watched Sandra and Lawson and the two officers move toward the elevator, and then she turned to Patrick. Call security. Ask them to send someone to the medical surgical floor. Tell them there's a law enforcement access situation and administration requested backup. Is that true? Sandra requested an escort, yes. Patrick reached for the phone. Emily stood at the front desk and watched the elevator doors close and looked at the clock and thought, with a clarity that surprised her with its sharpness, Ferris, whatever you're doing, you have 90 seconds. The doors opened at 10:03 p.m. Not the elevator. The main entrance. Colonel Ferris came through first, moving with a purpose that was contained and very fast. Behind him was the younger man from the afternoon, and behind him were two people Emily hadn't seen before, a woman in a dark suit carrying a document case, and a man in military dress uniform with the rank insignia of a full-bird colonel. The entrance lobby, which had been quiet in the thin late-evening way of a hospital at 10 o'clock, reorganized itself around their arrival. Ferris reached Emily in 12 steps. He didn't slow down. Where is he? Elevator, 3rd floor with Sandra Okafor and 2 officers. The warrant is vacated, he said, as of 9 minutes ago. Reyes is under military jurisdiction, and Lawson was notified through the precinct channel. He handed her a folder. He may not have received it yet, or he may have received it and chosen to proceed anyway. Either way, we need to be upstairs. The woman with the document case was already at the elevator. What's in the warrant? Emily said, moving alongside him. The real warrant. Lawson designated Reyes as a material witness to a controlled transaction connected to the operation. The problem is that the transaction Lawson is describing never happened. We have surveillance confirming it, which means either he has bad intel or he is the bad intel. Ferris looked at her directly. We've been looking at Lawson for 6 weeks. Tonight accelerated the timeline. Emily absorbed this without breaking stride. The suspect he brought in this morning? Nilsson. Kenneth Nilsson, yes. Who is he? An intermediary. Someone who moved information between units. Ferris pressed the elevator button. We believe Lawson was running him, using the arrest as a control mechanism. Take him in publicly, process him through medical, release him with revised instructions. Lawson needed the processing to go fast, so Nilsson could deliver something before the operation window closed. He paused. You slowed it down. The elevator opened. By accident, Emily said. Doesn't matter why, Ferris said. The window closed. The operation got compromised. 7 men came through your trauma bay. His voice was even, but there was something underneath it that wasn't. Lawson filed the complaint against you 3 hours after he released Nilsson. We think it was preemptive. If you became a disciplinary problem, anything you'd observed or reported would be weighted accordingly. The elevator opened on 3. The hallway was not what any of them had expected. Lawson was at the door of Reyes's room, and so was hospital security. A single guard named Walt, who was built for deterrence and clearly not for this specific situation. And so was Torres, who had planted himself in the doorway with his wrapped arm and his borrowed clothes and the expression of someone who understood exactly what his job was right now. Sandra stood slightly to the left, her arms at her sides, her face doing the work of containing something that wanted very much to be visible. Lawson had his hand on the doorframe. He had not physically moved Torres. He was in the moment just before that decision, the moment where a man with a badge weighs whether what comes next is worth it. Step aside, Lawson said to Torres. I'm a visitor, Torres said. Patient asked me to stay. You're obstructing Robert. The colonel in dress uniform said it once, quietly, from the far end of the hall. Lawson turned. His face did something complicated when he saw Ferris. Then it did something worse when he saw the dress uniform behind him. And then it went flat in the way of someone who has just understood something they were hoping not to understand yet. Officer Lawson, the woman with the document case said, walking forward. I'm Special Agent Diane Mercer, Defense Intelligence. I have documentation vacating your warrant for one Daniel Reyes, effective 9:54 p.m. tonight. She held out the folder. Additionally, I have a notification of investigation into your conduct in relation to Operation Sandline, specifically regarding your handling of a confidential informant and potential disclosure of operational parameters to a third party. The hallway was completely quiet. Lawson did not take the folder. He looked at it, then at Ferris, then at Emily, and the look he gave Emily was the most honest thing she'd seen from him all day. It was the look of a man recalculating everything from the beginning, trying to figure out at which point the equation had gone wrong. She could see him running it backward. The morning, the complaint, the suspect, her, all of it. "This is," he started, "Lawson." Ferris's voice was not loud. It didn't need to be. "Take the folder." Lawson took it. "Danny okay?" Torres said quietly, not moving from the doorway. "He's fine," Emily said. Torres nodded and stepped back from the door, but didn't leave. What followed was the specific kind of institutional reckoning that happens in hospital corridors at 10 o'clock at night when two systems of authority intersect in a space not designed for either of them. Sandra got her floor back in stages. First Lawson's two officers, who were quietly redirected to a waiting area by Walt, and a second security guard who'd arrived late, but with excellent timing. Then Mercer moved Lawson to an administrative conference room that Sandra unlocked without being asked, and Ferris and the dress-uniformed colonel followed them in. Emily stood in the hallway. Torres came out of Reyes's room and stood beside her. For a moment, neither of them said anything. "Is it over?" Torres asked. "This part," Emily said. "What does that mean?" "It means the immediate problem is resolved. The larger problem takes longer." She looked down the hall at the closed conference room door. "These things always take longer." Torres was quiet for a beat. "What did he do?" "Lawson." "I don't have the full picture." "But you know enough." "Yes." He nodded. He seemed like the kind of person who was very good at looking like he wasn't doing what he was doing. "Most of them are," Emily said. She pushed off the wall and went back to Sandra, who was standing near the nursing station on 3 with the expression of someone who had just run a marathon in dress shoes. "The patients are all stable," Emily said. "The floor is clean. Do you need anything from me tonight?" Sandra looked at her for a long moment. "How are you doing this?" "Doing what?" "Standing here like it's just another shift." Emily thought about that seriously for a second. "It's not just another shift, but falling apart about it doesn't help anything." She paused. "I'm very tired, if that helps." Sandra almost laughed. It didn't quite make it to the surface, but it was close. "Go home, Carter. We'll deal with the rest of this tomorrow. The complaint is the least of anyone's problems right now. Go." Emily went. But she didn't go home immediately. She sat in her car in the parking garage for 11 minutes, engine off, and let her hands do what they'd been waiting to do for the last 5 hours, which was shake slightly. Not much. Just the residual release of sustained adrenaline. She'd learned a long time ago not to suppress it. Suppressing it just meant it came out somewhere less convenient. You let it move through and then it was done. When her hands were steady, she started the car and drove. Her apartment was exactly as she'd left it, which was not particularly clean but was hers, which was enough. Rook appeared from somewhere and sat on the kitchen counter, looking at her with the specific feline accusation of an animal who'd had to eat on a schedule. She fed him. She stood at the kitchen window and looked at the city lights and tried to decide whether what she was feeling was relief or something more complicated that just had relief on top. Her phone buzzed. "Ferris. Debriefed Mercer. She needs your formal statement tomorrow. Voluntary, not compelled. 9 a.m. at the address I'll send. Not optional, but framed as your choice." She stared at that last line for a moment. Not optional, but framed as your choice. That was Ferris in a sentence, honestly. He'd always been like that, scrupulously transparent about the mechanism while still operating the mechanism. She typed back, "I'll be there." Then she put the phone down and made tea. She didn't drink, and eventually went to bed and lay in the particular wakeful stillness of someone whose body knows sleep is necessary and whose mind is not on board. She went through the day in order. Not obsessively, she'd learned not to spiral, but methodically, the way you check equipment after a mission. Everything accounted for. 7 soldiers coming through the ambulance doors. Reyes's face on the table, and the quality of his eyes when he was scared. Ferris, with his card and his confirmation. The warrant and the 17 minutes, and Sandra buying time with forms and signatures while Emily stood at the front desk and waited for the door to open. She thought about what Ferris had told her in the elevator, that she'd slowed Lawson's processing down by accident, and the window had closed, and the operation had been compromised. She thought about what that meant, that the timeline she'd disrupted by simply doing her job correctly had cascading consequences she could trace forward in both directions. The soldiers in the trauma bay, Reyes's legs, the 6-hour operation that had ended with 7 casualties. She didn't let herself go too far down that road. It was the wrong math. You couldn't run the counterfactual on every decision. What if she'd moved faster? What if she'd let Lawson rush the clearance? What if the window had stayed open? The operation had been compromised before she ever saw Lawson's face. The intelligence failure Ferris had mentioned was 3 days prior. She had been a variable in the last hour, not the cause. She knew this. She also knew that knowing it and feeling it were different things, and that at 1 a.m. in a dark apartment they were especially different. She slept eventually. Not well, but enough. She arrived at the address Ferris sent at 8:47 a.m. It was a federal building, not military, not police, something in between, the kind of address that appeared on no public directory and whose function was communicated by the quality of its security rather than any signage. She signed in, surrendered her phone, and was taken to a room that had good chairs and bad lighting and a table with water and coffee, which was either hospitality or a tell about how long this was going to take. Mercer was already there. Up close, she was younger than Emily had clocked last night, early 40s, with the focused composure of someone who'd spent years in rooms where precision mattered and imprecision had consequences. She had a recorder on the table and a legal pad and a pen. She clicked once and then didn't click again. "Thank you for coming," she said. "You said it wasn't optional," Emily said, taking a seat. "It's not legally compelled. You came voluntarily, which I appreciate." Mercer opened a folder. "I want to be clear about the scope of this. I'm not investigating you. Your actions yesterday at Riverside Memorial are not in question. What I need from you is a first-person account of your interactions with Officer Lawson, including the timing, location, and content of your exchanges, and separately, a description of your interaction with the incoming military casualties, specifically what you observed, what you did, and in what sequence." "All right," Emily said. "I also want to ask you about this morning's suspect, Kenneth Nilsson, whether you had any direct contact with him during the intake process." "I assessed his wound. That was the extent of my contact." "Did he say anything to you?" Emily thought back. The man on the gurney, handcuffed, barely conscious. She'd checked his pupils, his pulse. His eyes had been unfocused and slow. "He said one thing," she said. "When I was checking his grip response, he said, 'Tell him.' That was it. He wasn't coherent enough for it to mean anything specific." Mercer made a note. "Tell him. Not tell her, tell him." "That's what he said." Mercer wrote something Emily couldn't read from across the table. "And Lawson was present for that?" "He was a few feet away." "Did his behavior change after Nilsson spoke?" Emily replayed it. Lawson at the wall, his posture. After the brief exchange when she'd been at the gurney, had something shifted? She thought about the moment when she'd turned back and he'd been watching her more carefully. Not angrily. Carefully. Assessing. "Yes," she said. "Slightly." He became more focused on moving the process forward quickly. Before that he was irritated. After that he was, she chose her word, purposeful. Mercer nodded and wrote. The debrief took 2 hours and 20 minutes. Mercer was good at it. She never pushed, never loaded her questions with implication, just collected information in a sequence that felt chronological but wasn't, building a picture from the outside in. Emily answered everything she knew and said clearly when she didn't know it, which was the only way to be useful in a room like that. At the end, Mercer closed her folder and sat back. "Do you have questions?" "About the investigation, probably not ones you can answer," Emily said. "About Lawson, one. I'll tell you what I can. The complaint he filed against me yesterday, the negligence claim, the interference allegation. It will be formally withdrawn as part of the investigation process," Mercer said. "It's already flagged as potentially retaliatory given the timeline. Your record will reflect that it was vacated." "That's not my question," Emily said. My question is whether the complaint was his idea or whether someone told him to file it. Mercer looked at her steadily. The pause was a fraction of a second too long. That's part of what we're determining. Emily nodded. That was the answer she'd expected. Not a confirmation, but not a denial, and in that gap was the shape of something she hadn't fully considered yet. If the complaint had been directed, if someone above Lawson or adjacent to him had identified Emily as a variable to be managed, then the situation was not contained to one corrupt officer and one compromised operation. It was a thread pulling on something with more depth. She filed that thought carefully, in the place where she kept things she needed to return to. One more question, she said. Go ahead. The men you're investigating, the people Lawson was connected to, are any of them aware that the operation's exposure traces to his handling of Nilsson's processing time? Mercer's expression didn't change, but her pen went still. Why do you ask? Because if they are, Emily said, and if they've identified the same variable I just described, the nurse who slowed the clearance, then my name is in a file somewhere that I'd rather it not be in. The silence in the room had a different quality now. Mercer looked at her. That's a reasonable concern, she said carefully. Which means yes, Emily said. Mercer didn't confirm it and didn't deny it, and this time the shape of what was in the gap was much less abstract. Emily looked at her water glass and thought about what it meant that she'd slowed down an information pipeline by doing her job, and that somewhere, someone with motivation and resources and no particular concern for hospital nurses had noticed. Is there protective protocol for this situation? Emily asked. We're assessing, Mercer said. That means you don't have one yet. It means the situation evolved quickly. Mercer leaned forward slightly. Emily, the people Lawson was connected to are not. This is not a street-level criminal network. These are individuals with infrastructure. They're careful. They don't move impulsively. That's not reassuring. It's meant to be accurate, not reassuring. Mercer held her gaze. You're going to be monitored. Not in a way you'll feel, but in a way that matters. Colonel Ferris has already made that request. Is Ferris still here? He's down the hall. Emily stood. I'd like to see him. Mercer considered this for exactly 1 second. I'll take you to him. Whoa. Ferris was in a larger room down the corridor, standing over a table covered in documents and aerial photographs and the kind of organized intelligence spread that told Emily this had been ongoing for much longer than 6 weeks and was much larger than one officer with a compromised informant. He looked up when she came in, registered her expression, and sent the 2 people working the table out with a look. Mercer told you, he said. She told me enough to know you didn't tell me enough last night. Last night was triage. Tonight we can do context. The people Lawson was connected to, Emily said. Are they going to come for me? Ferris was quiet for a beat. 1 beat too long. We don't believe so. Moving against you directly would create exposure they don't want. Their operational model is Robert. She used his first name the way she'd used it before years ago, in the specific register that meant stop managing the information, talk to me. Is there a threat? He looked at her. And for the first time since he'd walked into Riverside Memorial, he looked tired. Not old, not broken, just carrying something that had gotten heavy. There may be, he said. We intercepted a communication this morning. It was encrypted and we have a partial translation, the relevant portion. He picked up a single sheet of paper and held it so she could read the last 4 lines of a transcribed message. She read it. She read it twice. Her name was in it. Not Emily Carter. A designation, a descriptor, a role. The intake obstruction. Identify and resolve. 4 words. In the clipped operational language of people who did not think of collateral damage as collateral. Identify and resolve. She set the paper down. When was this sent? She asked. This morning, 4:17 a.m. Ferris put the paper back on the table. Before you came here, before your debrief. You knew when you told me to come here? Yes. So this building is controlled. Yes, you're safe here. He paused. The question is what happens when you leave? Emily stood at the table and looked at the aerial photographs without seeing them, running through what she'd just read and what it meant and what it required. Identify and resolve. The operational grammar of it told her things about the people who'd sent it, their level of organization, their tolerance for precision over speed, the fact that they'd sent a query rather than an action. They were still in the gathering phase, which meant there was still time, but not the kind of time that waited patiently. "I can't stay in this building," she said. "No. And I can't go back to the hospital and pretend this is a normal week." "Also no. So what are you offering me, Robert?" He looked at her with those exhausted, careful eyes. "I have a proposal," he said. "It's not simple, and it requires something from you that I don't have any right to ask for, but—" His phone buzzed. He looked at it. Something crossed his face that she didn't have a name for. He turned the phone so she could see the screen. It was a message from a number listed only as Mercer 2, and it contained 3 words and an attachment icon that she understood to be surveillance footage. The 3 words were, "He's in the building." Emily looked at the message. Then she looked at the door of the room. Then she looked at Ferris, and what she saw on his face confirmed what she'd already understood, that whoever had sent the communication at 4:17 a.m., whoever had written identify and resolve in the clipped language of operational orders, had not waited. They had moved to the gathering phase faster than anyone had predicted. And they had found her. Ferris moved first. He crossed the room in 4 steps and pressed a button on the wall panel that Emily hadn't noticed. Recessed, no label, the kind of thing that blended into institutional paint on purpose. A light above the door shifted from green to amber. Somewhere in the building, a protocol had just been activated. "How did they get access?" Emily said. "We don't know yet." He was already on his phone, speaking in the compressed shorthand of someone running a procedure they'd rehearsed. "What we know is that the building's visitor log shows an entry 22 minutes ago under a credentialed federal contractor ID that cleared security. The ID is real. The person using it is not the person it belongs to." "So they have someone inside your credential system. They have access to it. That's different and also worse." He ended the call and looked at her. "Mercer is locking down the corridor. We have people moving to identify the individual. You need to stay in this room." "Staying in this room makes me a fixed position," Emily said. "This room is a known location in a building where someone just walked in with a credentialed cover. I understand the impulse to lock down, but if they're already through security, containment works for them more than it works for us." She looked at the door. "Where does that corridor go?" Ferris looked at her for 1 second. The specific second of a man recalibrating who was giving orders. "East Wing connects to the building's secondary facility. It's a different floor plan, different security grid. Is there someone on that grid who can meet us?" He was already typing on his phone. "Give me 30 seconds. She gave him 30 seconds, which she spent looking at the aerial photographs on the table. Not the ones she'd seen before. A different section of the spread, lower left, showing what looked like an industrial facility at the edge of Fairmont's Port District. She'd driven past that area twice in 2 years and never paid it attention. She looked at it now and made a note of what she was seeing without touching the paper. "We have an escort," Ferris said. "East Wing, now." They moved. The corridor outside was quiet in the wrong way. The way a room goes quiet when people in it have been told to be quiet, not the natural quiet of an empty space. Emily could see 2 agents at the far end standing with the alert stillness of people who had just received instruction. Mercer was not visible. The man at the security desk near the elevator was on his radio and not looking at the desk. Ferris put a hand at her elbow, not grabbing, just directional, and steered her left. They moved fast without running, which was the appropriate speed for a building that was managing a situation and did not want to escalate it through visible panic. Emily matched his pace and kept her eyes moving. She almost missed him. He was standing near the water fountain at the corridor intersection, holding a paper coffee cup and wearing the lanyard of a building contractor. I was in his 50s, unremarkable in the specific, deliberate way of someone who had spent considerable effort being unremarkable. He was looking at his phone. He did not look up when they passed. But Emily felt it, the almost imperceptible shift in his posture as they moved through his peripheral vision. The slight tension that moved through his shoulders and released. The way his thumb stopped moving on his phone screen. She didn't stop walking. She didn't look back. She said quietly, just loud enough for Ferris to catch it. "Water fountain, coffee cup, don't turn." Ferris kept walking, into his phone, barely moving his lips. Corridor B intersection, contractor lanyard. 20 seconds later, as they turned into the East Wing, Emily heard behind them the quiet, controlled commotion of two federal agents redirecting a man with a paper coffee cup and no good reason to be standing where he was standing. They didn't run. He didn't run. That was what the controlled version sounded like. The secondary facility was smaller, a suite of offices and conference rooms that felt more like a law firm than a federal building, which was probably intentional. A woman Emily hadn't seen before met them at the door, showed credentials to Ferris without being asked, and led them to a room in the back with no windows and very good soundproofing. Mercer arrived 4 minutes later. She was moving with the specific controlled energy of someone who was angry and had decided that anger was a resource to be managed rather than expressed. "We have him," she said. "His name is Voss. Gerald Voss. He's a contractor with Callaway Defense Analytics, a private firm with 3 federal contracts, and as of this morning, a significant amount of our attention." She sat down and opened her laptop. Voss is not talking. He lawyered up in the elevator, which took approximately 40 seconds, which tells you something about the level of preparation. "What does Callaway Defense Analytics do?" Emily asked. "Officially, logistics consulting for federal procurement. Actually," Mercer turned the laptop so Emily could see the screen. It showed a corporate filing, a board of directors list, and a network diagram with lines connecting names and entities. "They're an intermediary. They sit between defense contracts and a set of private interests who use those contracts to access sensitive operational data. Lawson was on their contractor payroll as a consultant, has been for 3 years." Emily looked at the network diagram. One name near the center of it was highlighted in red. "Who is that?" "His name is Aldrich Noman. He runs Callaway. Former intelligence, left the service under circumstances that were documented as voluntary but weren't." Mercer's voice was precise. "He's been building this for 7 years. Lawson was one of approximately 11 law enforcement contacts he'd cultivated across 3 cities. The operational model was elegant, honestly. Use law enforcement access to create legitimate-looking information pipelines, run intelligence through them, sell the product to private buyers. And the operation last night, Sandline was targeting one of Noman's buyers, a procurement deal for technology that should not be leaving federal custody. When Sandline got compromised, Noman needed to know what had failed and who had seen what." Mercer paused. "Nilsson, Lawson's informant, was supposed to deliver a package of information during the processing window. Operational details, personnel identifiers. When the window closed, the operation moved without the intel," Emily said. "Yes, 7 casualties instead of a clean extraction." Mercer said it flatly, but something moved behind her eyes. "Noman needed to know why the window closed. Lawson identified the intake delay. Identified you." Emily sat with that for a moment. The full weight of the chain, her insistence on proper imaging protocol, a custody window closing 30 minutes late, an operation running without critical intelligence, 7 men on gurneys at 4:51 p.m., had a particular heaviness that she was going to have to process somewhere private later when there was time for it. "What does Noman know about me specifically?" she said. "Your name, your position, your shift schedule, as of last night." Mercer glanced at Ferris. "He does not know your military record. That file is classified at a level that his network hasn't penetrated, which means his current assessment of you is the same as Lawson's," Emily said. "A nurse who got in the way." "Yes, which means his threat calculus is based on an incomplete picture of what I'd be able to do with whatever I know." Mercer looked at her. "That's one way to frame it." "It's also an advantage," Ferris said. "If Noman believed you were a former special operations medic with full knowledge of what his network was running, Voss wouldn't have come here with a coffee cup. He'd have sent something else." The room was quiet for a moment. Emily looked at the network diagram on Mercer's laptop, at the lines connecting Lawson to Callaway to Noman to a set of international buyer designations at the edges of the map, at the aerial photograph she'd seen in the other room and recognized now in a different context. The industrial facility at Fairmont's Port District was on the diagram, tagged with a location code. "That facility," she said, "Port District, Eastern Edge." "What is it?" Mercer looked at the screen. "Currently registered as a marine equipment storage company. We believe it's a transfer point." She paused. "Why?" "I saw the photograph in the other room. I've driven past that location. There's a secondary access road on the north side that isn't visible from the main route. You wouldn't know it was there unless you'd approached from the estuary side. She stopped. I ran that route for 8 months before I changed my morning path. Ferris looked at her. You've been near that facility. Not intentionally. I run the estuary path because it's quiet at 5 a.m., and the lighting is better than the industrial route. She held his gaze. I've seen vehicles there before sunrise. Not every day. Irregular intervals. I didn't think anything of it. Can you describe the vehicles? Unmarked panel vans, usually 2. Once a flatbed with a covered load. I didn't have any reason to log it, so I didn't. Mercer was typing. What time intervals? 3, 4 weeks apart, except... Emily paused, running her memory back with the careful, methodical attention she applied to clinical recall. 3 weeks ago, it was 2 days in a row. I noticed because that was unusual. Ferris and Mercer exchanged a look that contained an entire conversation Emily wasn't part of. 3 weeks ago, Mercer said carefully, was when Sandline's preliminary planning phase began. Nobody said anything for a moment. I need to make a call, Mercer said, standing. She was already moving toward the door. Ferris stayed. He looked at Emily across the table with an expression that had moved past the professional management of information into something more direct. You understand what you've just given us, he said, corroborating observation on a location you already had flagged. Corroborating observation from an unconnected civilian witness with a documented routine that puts her near the facility on a regular schedule. He leaned forward. That's the kind of testimony that makes a case airtight in front of a federal judge, especially from someone with your credibility profile. My credibility profile, Emily said. Former military. Decorated service record. No disciplinary history in civilian life. And as of yesterday, documented as the person who correctly identified and treated a tension pneumothorax under pressure and saved the life of a military specialist. He paused. Lawson's complaint against you, which was designed to undermine your credibility, is now going to function as evidence of the network's attempt to preemptively neutralize a witness. It backfired significantly. Emily looked at him. You're telling me that Derek Lawson trying to get me fired is going to help you prosecute his handler? Among other things. She took a breath, released it. There was something almost absurd about it. The complaint that was meant to erase her had instead drawn a line under her name in the most visible possible way, made her central to a federal investigation's evidentiary structure, made her uncancelable in precisely the context where someone had tried to cancel her. She didn't find it satisfying yet. That would come later, or it wouldn't. Right now, it was just a fact. What do you need from me, she said. A formal statement about the Port District observations, and your cooperation for the next phase. What's the next phase? Ferris picked up his phone. Ask Mercer that. She's running it now. Mercer came back 12 minutes later with 2 other people and a shift in the room's energy that Emily recognized as the specific gravity of a plan moving from planning to execution. We're moving on the facility tonight, Mercer said without preamble. We had enough for the warrant application before your observations. Your corroboration accelerated the judicial timeline by approximately 48 hours. She looked at Emily with the level assessment of someone deciding how much operational information to share. We're not asking you to be involved in the physical operation, but there's a separate action happening simultaneously that requires your presence. Where? Riverside Memorial. Emily waited. Lawson's formal arrest is happening at 6 p.m. today, Mercer said. At the precinct, with federal oversight, in coordination with the police department's internal affairs division. We have 9 officers from IA on board. This goes beyond Lawson. There are 2 other members of his unit implicated. The arrest will be public record as of the moment it happens. She paused. The hospital, Administrator Pruitt, Chief of Nursing Okafor, needs to be formally notified that the complaint filed against you yesterday was part of a documented pattern of retaliatory action connected to a federal investigation. That notification needs to come from us, in person, on the record. You want me there for that. We want you there because the complaint is in your personnel file and the formal retraction requires your presence to be complete. Also because Mercer's voice did something that was almost, not quite, personal. Because you're the one who held the line yesterday and nobody who was watching understood what they were seeing. A formal record should reflect that. Emily looked at the table. She thought about Sandra, who'd gone to the front desk at 10 o'clock at night in her regular work clothes and bought time with paperwork and competence. She thought about Jenna, who'd been 25 and outraged and hadn't said anything and had hated herself for it. She thought about Patrick at the intake desk, who'd pulled up forms with the slow, careful movements of someone who'd understood what was needed without being told. "All right," she said. "I'll be there." Riverside Memorial at 4:30 p.m. looked exactly like it always did. Overcrowded, understaffed, smelling of antiseptic and coffee, and the accumulated wear of a building that processed human crisis on an industrial scale. Emily walked in through the main entrance in the same clothes she'd worn to the debrief and felt the specific dissonance of a place that had been the center of everything and had no idea yet. Jenna was at the desk. She saw Emily, and her face did three things in rapid sequence: relief, confusion, and then the particular look of someone who had spent the night regretting something. "You're here," Jenna said. "I'm here." "I heard. There were people here this morning, federal people, talking to Sandra. Nobody told us anything." She lowered her voice. "Is everything okay? With the complaint?" "The complaint is being handled," Emily said. "Where's Sandra?" "Her office. She's been in there all day." Emily went to Sandra's office and knocked once and went in. Sandra looked up from her desk with the expression of someone who had been waiting for something and wasn't sure whether what had just arrived was it. Mercer came in 30 seconds behind Emily and laid a formal document on Sandra's desk, which Sandra read with the careful attention of someone who understood that every word on official paper mattered. Emily watched her read it. Watched her get to the section that described Lawson's complaint as a documented act of retaliatory intimidation connected to an active federal investigation. Watched her jaw do the small, controlled thing it did when she was processing something significant. "This will be entered into your personnel file," Mercer told Emily, "as a formal retraction and a commendation notation from the Defense Intelligence Office for cooperation with a federal matter." "A commendation," Sandra said, still looking at the document, "for actions on the evening of the 15th that directly supported an active military and federal investigation, including emergency medical intervention, witness cooperation, and—" Mercer paused, looking at her own document with something that was almost amusement. "And what is described here as tactical administrative delay of a law enforcement transfer, executed with precision." Sandra looked at Emily. Emily looked at the wall. "Tactical administrative delay," Sandra said. "That's one way to put it," Emily said. Sandra set the document down and took her reading glasses off and pressed two fingers to the bridge of her nose. "I need a minute," she said. "Take your time," Mercer said. "A federal officer filed a complaint against one of my nurses for doing her job correctly, and it turns out that nurse was—" "What exactly?" "A former military operative. And the officer was running intelligence for a defense contractor?" She looked between them. "Is there anything else about the last 24 hours that I should know before I call the board?" "The 7 soldiers from last night are all expected to make full or substantial recoveries," Mercer said. "Specialist Reyes is stable and will be transferred to a military medical facility tomorrow morning." Sandra nodded. "And Lawson?" "Arrested at approximately—" Mercer checked her phone. 6 minutes ago." The room was quiet. 6 minutes ago," Sandra repeated. "The formal charges include corruption, unauthorized disclosure of sensitive operational data, obstruction of a federal investigation, and filing a fraudulent law enforcement complaint." Mercer paused. "The last charge was added this morning." Emily watched Sandra absorb this in stages. She was good at that, at receiving large amounts of information and integrating it without losing the thread of what it required from her. She was already thinking about the board call, the staff notification, the HR documentation, the media inquiry that would come when the arrest hit the public record. "I'll need a point of contact for the hospital's records request," Sandra said finally, in her administrative voice that was the voice she used when she had decided to get on with it. "I'll send it today," Mercer said. Sandra looked at Emily. A long look, the kind that went past professional assessment into something more direct. "You knew," she said. "Yesterday morning, you knew something was wrong with him." "I knew he was out of proportion," Emily said. "I didn't know why." "But you held." "Yes. Even when Pruitt called you, even when I told you to keep your head down. You told me to do my job without giving him additional material to work with," Emily said. "That's what I did." Sandra made a sound that wasn't quite a laugh and wasn't quite a sigh. "Go take your jacket off," she said. "You're on shift in 20 minutes." The floor felt different, not dramatically, not in any way that was visible to someone walking in from outside. The patients were the same, the charts were the same, the monitors alarmed on the same rhythms. But the people on it knew, by the invisible, fast-moving current of institutional knowledge, that something had happened. Jenna was at the nursing station when Emily came back to the floor, and Marcus was there, and two other nurses whose names were Petra and Donaldson, and they all looked at her with varying degrees of the same expression. Not awe exactly, but the particular recalibration of people who have been looking at something one way and have just learned to look at it another way. Nobody said anything directly. That was its own kind of acknowledgement. Marcus handed her a chart. Bed 2 is a 44-year-old post-cardiac event, stable, anxious. Bed 6 is a pediatric transfer waiting on a room upstairs. Got it, Emily said, and went to work. She was at bed 2 for 11 minutes, long enough to establish that the patient, a man named Harold, who had the face of someone who'd just had a very bad week and knew it, needed information more than medication right now. She explained his numbers to him in plain language. She answered his questions without rushing. She was there until he looked slightly less like a man watching the floor for cracks. She was walking back to the station when Torres appeared at the ER entrance. He was in different clothes, his own, this time, which fit. His arm was in a proper sling rather than the soft wrap, and he moved more carefully than yesterday but more freely than this morning. He looked around the ER until he found her and then walked over with the direct, unhurried movement of someone who knew what they'd come to say. "You should be in bed," Emily said. "I got cleared for limited mobility. Doc said 24 hours of rest was sufficient." He stopped in front of her. "I heard about Lawson. News travels. Military channels travel fast." He looked at her steadily. "I also heard there was a situation at the federal building this morning, that somebody tried—" He stopped. "Reorganized. Are you all right?" "Yes." "That's not what I asked." Emily looked at him. He was 20-something, with an arm in a sling and stitches above his left eyebrow, and the earnest, direct quality of someone who hadn't yet learned to soften concern into something more manageable. "I'm tired," she said, which was true and more than she'd said to most people. "But I'm all right." He nodded. "Reyes wanted me to bring you something." He reached into his jacket pocket with his good arm and produced a folded piece of paper. He said he was going to write it on a cocktail napkin, but they don't have cocktail napkins in military surgical wards, so he used the back of a discharge information sheet. Emily unfolded it. Reyes's handwriting was large and slightly uneven, the handwriting of someone who'd written it quickly and probably with his arm at a bad angle. "Carter, you said I was going to be okay like you already knew. Turned out you were right. Thank you for knowing. Reyes." She folded it again and put it in her pocket. "Tell him he's welcome," she said. Torres nodded. He seemed like he had more to say and was deciding against it, which Emily appreciated. He turned to go. "Torres," she said. He looked back. "The men from the operation. All of them. They're going to need real follow-up care. Not just medical, the kind that takes longer and doesn't have a clear endpoint." She held his gaze. "Make sure someone makes that happen. Don't let it get managed into a checkbox." He looked at her for a moment. "Is that something you know about? From before?" "Yes." He nodded. "I'll make sure," he said. She believed him. At 8 p.m., Ferris appeared at the hospital entrance. He wasn't in any official capacity. No Mercer, no document case, no escort. He was in the plain clothes he'd had on that morning, and he looked like someone who had spent 12 hours running a complex situation and was now, for the first time, not running it. Emily saw him from the nursing station and finished what she was doing before she went to him. He was standing near the waiting area, hands in his pockets, looking at the floor with the slightly unfocused expression of someone whose mind was still moving, even though their body had stopped. "The facility operation went clean," he said when she reached him. "Port District. Noman wasn't there, but we have everything he left behind, which is more than enough. He'll surface. People like him always need to surface eventually." He paused. "Lawson's been processed. 2 of his unit are in custody. The 3rd is cooperating." "Nilsson?" "In protective custody pending full debrief." He looked at her. "The case is going to take 18 months minimum to fully prosecute. It's federal, it's complicated, and there are international dimensions that Mercer's team is still mapping. But the immediate threat—" He stopped. "Say it clearly, Robert." The immediate threat to you is resolved. Voss is in custody. Noman doesn't have the resources to mount another action in Fairmont right now. His network in this region is effectively dismantled. He looked at her with a directness that was different from his operational manner, quieter, more personal. You're not in danger tonight. Emily took a breath. Okay. Is that all you're going to say? What would you like me to say? He looked at her for a moment. I'd like you to tell me what you're actually thinking. She considered deflecting. She'd gotten very good at deflecting in the years since she'd left the unit, in the quiet work of rebuilding a life in smaller dimensions. But Ferris had come here without an agenda tonight, and that meant something. I'm thinking, she said, that I slowed down a custody clearance by 30 minutes because the protocol required it, and the downstream consequences of that 30 minutes are going to take 18 months to fully understand. She paused. I'm also thinking that a man looked at me yesterday morning and saw nothing worth accounting for, and that assumption about what I was and what I was capable of ran through everything he did after, every decision he made, right up until it didn't. Ferris was quiet. I'm not saying I'm glad it happened this way, she said. 7 men came through those doors. Reyes is going to need 8 months of physical therapy. She looked at him steadily. But Derek Lawson decided I was powerless because of what he could see. He never considered what he couldn't. Ferris nodded slowly. He wasn't the only one who underestimated you. Who else? He held her gaze. Noman's network flagged you as intake obstruction. Not a person, a procedural delay. Even after Voss confirmed you were the specific individual, they still categorized you as a low-priority administrative variable. He paused. They sent Voss with a coffee cup. Not an operation. A surveillance errand. Emily understood what he wasn't saying. They'd looked at her and seen exactly what Lawson had seen. A hospital nurse. A procedural inconvenience, something to identify and manage quietly. They had not seen someone who would recognize a surveillance posture in a federal building corridor. They had not anticipated that the thing they were trying to neutralize had already noticed them. That's the proposal you mentioned this morning, she said, before Mercer interrupted. He looked at her carefully. Yes. You want me back. The unit has a civilian medical liaison role that's been vacant for 2 years. It's not field deployment. It's case adjacent, trauma consultation, medical intelligence, occasionally operational support in controlled environments. He paused. You'd keep your position here. It's not a choice between one and the other. Emily looked at the ER floor, at Harold in bed 2, whose anxiety had settled slightly, but who would be back in 3 days if nobody followed up properly. At the empty bed 6, where the pediatric transfer had finally gone upstairs. At Jenna at the nursing station, who was 25 and outraged and getting better at knowing when to speak. I'll think about it, she said. That's more than I expected, Ferris admitted. Don't push it, she said. He almost smiled. One more thing. The formal commendation from the Defense Intelligence Office. Mercer filed it today, but there's a separate notation being added from the unit. Classified, so you won't see it in your civilian file, but it's there. He paused. For what you did in the trauma bay. Reyes specifically. The medical officer who reviewed the case said the tension pneumothorax call was textbook forward operating response, timing, method, decision threshold. He said most experienced military medics wouldn't have moved faster. Emily looked at the floor for a moment. Tell him I said thank you. Tell him yourself, Ferris said. He's going to want to meet you. He said goodnight and left. Emily stood near the waiting area for a moment after he went, in the ambient noise of the hospital at 8 p.m. Monitors, conversations, someone's television in the waiting room turned to a news channel. She reached into her scrubs pocket and felt the folded paper Reyes had sent. She left it there. She was about to turn back to the floor when her phone buzzed. An unknown number. Not Ferris's, she had that logged. Not Mercer's. Unknown, with a Fairmont area code that resolved to nothing in her contacts. She answered it. Silence for 2 seconds. Then a voice she didn't recognize. Male, careful, with the flattened affect of someone reading from a script or controlling themselves very deliberately. Emily Carter, the voice said. Not a question. She said nothing. My name isn't important, the voice said. What's important is that you understand something. Lawson was a useful tool. Voss was an acceptable loss. The facility at the Port District was one of 4. You've caused us an inconvenience. A pause. Not a problem. An inconvenience. Emily stood completely still. The people who reviewed your file today, the voice continued, found something interesting, something that wasn't in the intake record Lawson pulled, something that changes the category you fall into. Another pause, deliberate and calibrated. We know what you did in Kandahar. We know your clearance level. And we know that Colonel Robert Ferris has been trying to bring you back into active consultation for 8 months. Her chest had gone cold in the specific spreading way of someone who has just understood that the size of the problem is not what they thought it was. You're not an inconvenience anymore, the voice said. You're an asset we'd like to discuss acquiring, before Ferris does. The line was quiet for one more second. Think about it. We'll be in touch. The call ended. Emily stood in the Riverside Memorial waiting area with a dead phone in her hand, and the noise of the hospital moving around her, and what she felt was not fear. It moved through the register of fear and kept going, into something older and more precise that had a different name and a different set of requirements. She pulled up Ferris's number. He answered on the second ring. They have my classified file, she said. The silence on his end lasted exactly as long as it needed to for her to understand that the situation she'd thought was resolved had just opened into something that was going to require considerably more than 18 months to close. They have my classified file, she said. Ferris didn't speak for 3 full seconds. In the background, she could hear the sound of a car door, movement, the sharp compression of someone switching modes. Where are you right now? ER waiting area, main entrance. Don't move. Don't go outside. His voice had shed everything except function. I'm 12 minutes away. Get to a room with staff around you and keep your phone in your hand. I know how to stay safe in a building, Robert. I know you do. Do it anyway. She went back to the nursing station, not because she needed the protection of numbers, but because standing alone in a waiting room with a dead phone call in her memory felt like offering something to a situation that hadn't finished presenting itself. Marcus looked up when she came back to the desk. She must have looked different in some way she wasn't managing, because he didn't say anything, just moved a half step to the left in the instinctive way of someone making room. She stood at the station and thought about the voice on the phone, the flattened affect, the deliberate pacing, the specific information chosen, Kandahar, her clearance level, Ferris's timeline, not to threaten her but to demonstrate capability, to establish that the picture they had of her was complete. She had been in enough operational environments to recognize the distinction between a threat and a demonstration of reach, and what the call had been was the second thing, an audition, an opening bid in a conversation they wanted to have. They weren't going to move against her, not yet. They wanted her to understand what she was worth to them before they decided whether she was more useful as an asset or a liability. The problem with that calculus, from their perspective, was that it required her to be frightened enough to consider the offer seriously, but not frightened enough to move against them immediately. It was a narrow window. And in Emily's specific experience, people who relied on managing that window for very long usually discovered they'd misread it. She was not frightened. She was precise. There was a difference, and it mattered. Ferris arrived in 11 minutes, not 12, with Mercer behind him and 2 people she hadn't seen before who moved with the specific economy of people whose job was physical security. They came through the main entrance without drama and reached the nursing station before anyone on the floor had fully registered their presence. Mercer had a phone in her hand. The call was routed through 3 relay points. We have the origin trace running, but these people know how to route. It'll take a few hours. She looked at Emily with the careful assessment she'd been using since yesterday. What was the exact phrasing? The part about your file? Emily repeated it verbatim. She had a good memory for language under pressure. Another thing the unit had developed in her, the capacity to store exact words when exact words were going to matter later. Mercer was typing before Emily finished the last sentence. They said Kandahar by name. Yes. That operation is classified at a level that requires... She stopped typing and looked at Ferris. The look carried the full weight of what she wasn't saying in front of a hospital nursing station at 8 p.m. Say it, Emily said. Mercer looked at her. That level of classification has a very short list of access points. If they pulled Kandahar from your record, they didn't get it through Callaway's contractor network. That level of penetration requires either a direct breach of a secured federal database or someone inside who provided it voluntarily, Emily said. Yes. The three of them stood at the nursing station in the noise of the ER, and the thing that had just been said arranged itself into its full implications. Not a rogue contractor, not a compromised cop, something with reach into a federal system, with access to records that were not supposed to exist in any form that could be extracted and read by someone making phone calls to hospital waiting rooms. "How long to identify the access point?" Emily said. "If it was a database breach, the forensic audit takes 48 to 72 hours minimum." Mercer paused. "If it was a voluntary disclosure, it depends on who and how careful they were about covering it." "So you don't know tonight?" "No." Emily looked at Ferris. "The offer they made. They want me before you bring me in officially, which means they know your timeline, which means they knew about your proposal before tonight." Ferris's expression didn't change in any dramatic way, but something behind it did. A small, controlled reckoning with a possibility he'd been hoping wasn't the one they were dealing with. "I discussed the liaison proposal with 2 people inside the unit," he said carefully, "in the last 8 months. "Then you have a short list," Emily said. He nodded once and said nothing else, because there was nothing else to say until the audit confirmed it, and saying it out loud in a hospital didn't make the list shorter or the answer easier. "What do you need from me tonight?" Emily asked Mercer. "A controlled response to that call. We want them to believe the approach is working, that you're considering the offer, that you're uncertain, that you haven't immediately gone to us." She paused. "We need you to call that number back." "And say what?" "That you need time, that you want proof of what they have before you commit to anything. It buys us the 48 hours to run the audit and triangulate the origin point." Mercer held her gaze. "Can you do that?" Emily thought about the voice on the phone, the calibrated pauses, the deliberate demonstration of knowledge. She thought about what it required to sound uncertain to people who were specifically looking for certainty underneath uncertainty. "Yes," she said. They set it up in Sandra's conference room, which Sandra surrendered without asking questions that she clearly had, because she had read Mercer's document and understood enough to know that her conference room was the least consequential thing being asked of her tonight. Mercer's technical person, a young woman named Taft, who moved with the careful speed of someone who'd done this in worse conditions, had the call routed and monitored in 4 minutes. Emily sat at the conference table with the phone in front of her and Mercer to her left, and Ferris against the wall, and Taft at a laptop that was doing several things simultaneously. She looked at the unknown number in her call log. She looked at it the way she looked at a procedure she'd done 100 times and was about to do in a situation where the margin for error was different. She dialed. It rang twice. The same voice. "You called back faster than we expected," it said. "I'm not interested in being managed," Emily said. Her voice was level and slightly harder than neutral. Not the deference they were expecting, not the resistance that would close the door. "If you have my file, you know I don't respond well to calibrated approaches. So let's skip the next 3 steps and get to the part where you tell me what you actually want." A pause. Recalibration on the other end. "Direct," the voice said. "All right. We want your skills and your existing relationship with Ferris's unit. We want you as a point of access and an intelligence relay. In exchange, we keep your classified record out of channels where it would complicate your current life." "That's not an exchange," Emily said. "That's leverage with a bow on it. Call it what you want. The offer stands. I need to know what you actually have, not a summary, specifics." She paused, timing it. "Kandahar is a broad designation. There were a lot of people in that theater. If you have something specific enough to matter, I need to see it before I consider anything." Another pause, longer this time. She could hear the calculation in it, whether giving her specifics was more valuable than maintaining the information asymmetry. They would likely decide specifics built credibility. People making offers usually decided that. "We'll be in touch within 24 hours with a verification package," the voice said. "Don't move on us in the interim." "I'm not moving anywhere," Emily said, which was the most precisely true thing she'd said in the conversation. The line went dead. Taft looked up from her laptop. "Good. They stayed on long enough for the second relay trace. We have a geographic range. It's not a precise location, but it's a district. Mercer, I can have this narrowed in 6 hours." "Do it," Mercer said. Then she looked at Emily. "You push them towards sending verification material. If they do, it becomes evidence. And whatever method they use to deliver it tells us something about their operational infrastructure." I know, Emily said. That's why I asked for it. Mercer looked at her with an expression that had passed well beyond professional assessment into something more straightforward. You've done this before, she said. Not a question. Not exactly this, Emily said, but close enough. The next 48 hours moved in the specific rhythm of institutional momentum, the kind of pace that felt slow in individual moments and very fast when you looked at what had accumulated. Emily worked her shifts. She came in, she did her job, she went home. She fed Rook and ran her morning route, which she now knew was being monitored by people she couldn't see, but whose presence she understood and found, if not comforting, at least professionally reassuring. On the second morning, Taft's trace resolved to a building in the financial district, a law firm registered in Delaware with offices in 6 cities, the kind of entity that existed to provide legitimate infrastructure to illegitimate operations. The forensic audit on the classified database breach came back in 31 hours with a specific access point, a terminal inside a federal contractor facility in Virginia, accessed by a credentialed user who had left the building 6 minutes after pulling Emily's file and not returned. The credentialed user's name was Wallace Hurd. He was 61, a 20-year federal intelligence veteran, a former colleague of Ferris's from a posting in the mid-2000s, and he had been on Callaway Defense Analytics Advisory Board under a consulting agreement that had been deliberately structured to be invisible in standard disclosure reviews. Ferris received this information on a Thursday morning and did not call Emily. He called Mercer. He called the Justice Department's National Security Division. He called the Inspector General's office for the relevant agency. He mud these calls in a sequence that had been planned for a scenario he'd hoped he wouldn't need it for, and he made them correctly. And by Thursday afternoon, Wallace Hurd was in federal custody pending charges that included unauthorized access to classified personnel records, conspiracy to obstruct a federal investigation, and material support to a criminal intelligence network. Emily found out about Hurd on Thursday evening when Ferris finally called her. His voice on the phone had the sound of someone who had been carrying something heavy for a long time and had just put it down. Not relieved exactly, because putting down something you'd been carrying for a long time came with its own kind of weight, but different, changed in some small way. "It's done," he said. "Hurd," she said. "You knew." "I thought it was likely. The timeline of when they got my file relative to when you made the proposal. It was someone who knew about the proposal. You said 2 people. Hurd was one of them." "Yes." A pause. "I'm sorry, Emily. He had access because I trusted him with it. That's on me." She didn't argue with that because it was accurate and he knew it, and arguing wouldn't make it less true. What happens now? The network continues to collapse. Noman surfaced in Brussels 3 days ago. Interpol has him in custody pending extradition. The 3 remaining facilities are being processed. The buyers, the international end of the chain, are a longer timeline. But Mercer says 18 months is conservative now. It's moving faster than projected. And the call they promised me, the verification package, never came, Ferris said. When Hurd was arrested, someone inside the network made a decision that the Emily Carter operation was compromised and went dark. The phone number is dead. The law firm in the financial district was vacated within 6 hours of Hurd's arrest. They cut the thread. They cut everything they could cut quickly. It's what networks like this do when they start losing nodes. They amputate and reorganize. But they reorganize with less than they started with, and every amputation leaves a record. He paused. They won't be approaching you again, not in any configuration that matters. Emily stood at her kitchen window with the phone against her ear and looked at the city in the particular way she'd developed of looking at it. Not as a place that contained threats, because everywhere contained threats, but as a place she'd chosen and had some say in. That was different from safety. It was better than safety. "Robert," she said. "Yes." "The proposal, the liaison role." He waited. "I'll do it," she said. "On my terms." "Which are?" "I keep my position at Riverside Memorial. Full schedule, no reduction. The liaison work is around it, not instead of it." She paused. "And I want full disclosure of any operational involvement that directly affects my civilian role. No more situations where I'm a variable in something I don't have the context for. That last one is going to require some navigation." "I know, navigate it." a sound that might have been the closest Ferris got to a laugh in a professional context. "All right," he said. "Welcome back." "Don't make it ceremonial," she said, and hung up. The public record of Derek Lawson's arrest and the subsequent federal charges hit the Fairmont news cycle on a Friday morning, which meant it ran through the weekend in the particular way of a story with enough layers to keep feeding. The initial report was factual and thin: corruption charges, federal investigation, 2 additional officers from his unit. By Saturday afternoon, the background had filled in enough for the shape of it to be visible. A law enforcement officer who had systematically used his position to run intelligence for a private defense contractor, who had filed a fraudulent complaint against a hospital nurse to discredit a potential witness, who had processed an informant through a medical facility as a cover for an information transfer that had contributed indirectly to casualties during a military operation. The nurse's name was not in the early reports. Mercer had made sure of that, and Emily had not sought it. But Fairmont was not a large city, and Riverside Memorial was not an anonymous institution, and the people who worked there had been watching the story the same way everyone else had. On Saturday morning, Sandra called an all-staff meeting for the nursing department. Not a crisis meeting, the kind she called occasionally when something needed to be said to everyone in the same room at the same time. Emily came in off a rest day and stood at the back, slightly uncomfortable with what she suspected was coming. Sandra stood at the front with her glasses on and her hands at her sides and told the department, in plain language, what had happened. Not all of it. The classified dimension stayed classified, but the shape of it. An officer had filed a false complaint against a member of their staff in retaliation for doing her job. That complaint had been formally retracted and designated as fraudulent by federal investigators. The staff member in question had cooperated with a federal investigation, provided care to 7 military casualties under extreme pressure, and continued to report for her scheduled shifts throughout. "The person I'm describing," Sandra said, "is Emily Carter, who is standing at the back of this room and is probably deeply uncomfortable with this conversation." A few people looked back. Emily did not visibly react, which required some effort. "I want to say something about what happened here on Monday," Sandra continued, "because I've been thinking about it all week, and I think it's worth saying out loud. A man came into this department with a badge and a loud voice and complete certainty that he could make one of us small. He chose Emily because she was a nurse, because he thought that was a container he could keep her in." She paused. "He was wrong, but I want to be honest. I was also wrong. Not about Emily, about whether to hold the line with her or find a way to make the situation easier for the hospital. I made some calls this week that I shouldn't have had to make, and Emily made some calls that I should have supported earlier." She looked at the back of the room. "I'm saying that in front of everyone because it's true, and because the people who work here deserve to know that when someone in this department does the right thing under pressure, the administration's job is to be behind them, not to look for the smoothest exit." The room was quiet. Emily looked at the floor. "That's all," Sandra said. "Thank you for coming in." People filed out. Several of them stopped near Emily. Jenna first, who looked like she'd been working up to this for days and had finally arrived at it. "I should have said something Monday morning. I didn't. I'm sorry." Emily told her she didn't need to apologize. Jenna told her she did, and that was the end of it. Marcus gave her a nod that communicated approximately everything without requiring either of them to be verbose about it, which was the right approach, and Emily respected him for it. Petra and Donaldson said things that were genuine and slightly awkward, which is what genuine things often were, and Emily received them without deflecting. She went to find Sandra afterward. Sandra was in her office, already on the phone, already managing the next thing. She held up one finger when Emily appeared and finished the call in 90 seconds and put the phone down. "Too much?" Sandra said. "A little," Emily said, "but accurate." "I meant what I said." "I know. That's why it was a little too much." Emily paused. "Sandra, you bought me 20 minutes at the front desk, with forms and a liability waiver. That was not nothing." Sandra looked at her. "It was the least I could do, and I knew it was the least I could do while I was doing it." "It was enough," Emily said. "Sometimes the least you can do is enough." Sandra was quiet for a moment. Then she pushed her glasses up and picked up the next folder on her desk. "I'm putting you in for the Clinical Excellence nomination. End of quarter review." "That's not necessary." "It's an annual form. I fill one out for one person per quarter. You're the person this quarter." She opened the folder. Go do your job, Carter. Emily went. 3 weeks after the arrest, on a Tuesday morning when the city was doing the particular quiet thing it did between rain systems, Emily ran her usual route. Past the estuary, past the industrial stretch, past the access road on the north side of the port facility that was now a federal crime scene with tape still visible at the perimeter. She ran past it the way she ran past everything on that route, at the same pace, without breaking stride, noting it, and moving on. She was back at her apartment, stretching in the doorway, when her phone showed a text from an unknown number that resolved immediately into Reyes's voice when she called it back. I got your number from Torres, he said. I hope that's okay. It's fine, how are you? 6 weeks into PT, it's... A pause. The honest pause of someone deciding not to perform wellness. It's slow. Some days are better than others. That's what 6 weeks looks like, Emily said. At 8 weeks, it's different. You sound like my physical therapist. Your physical therapist is right. He laughed, which was a good sound. I wanted to tell you something. They're doing an internal review of the operation, full after action, and they're including the medical response in the final report. What happened at Riverside Memorial, who did what, how the triage went. He paused. Your name is in it, not as a footnote, as a primary response asset. Emily stood in her door and thought about that. Primary response asset. The language of operational reports, dry, categorical, nothing to do with the actual texture of what it meant to put a needle in a man's chest in a civilian trauma bay and watch his oxygen stats climb back from the edge. I appreciate you telling me, she said. I also wanted to say, he stopped, started again. You told me to look at your face when I was on the table, and I did, and it helped. Not because you said it would be okay, because you looked like you knew what you were doing, like you'd done it before and it had worked before. Another pause. I think that's what people need sometimes. Not someone who tells them it'll be fine. Someone who looks like they've already been there and come back. Emily leaned against the doorframe. Outside, the city was getting on with itself. Traffic, voices, a dog barking somewhere down the block. How's your head? She asked. Not the medical question. The other one. A beat. Working on it, Reyes said. I found someone to talk to, a therapist. I don't know. It's early. That's the right call. Torres said you told him to make sure we all did it, the follow-up care. I did. He's annoying about it, in a good way. He paused. I wanted you to know it mattered, what you said. Emily was quiet for a moment. Out the window, the last of the rain clouds were breaking up over the eastern part of the city, and where they broke, the light came through in the particular way it did after weather, clean and slightly surprised at itself. Take care of yourself, specialist, she said. Yes, ma'am, he said, and she could hear in it something lighter than when they'd started talking. She put the phone down and finished her stretch and made coffee and sat at the kitchen table for a while, not doing anything in particular. Rook appeared from under the table and sat on the chair across from her and regarded her with the steady, slightly judgmental attention of an animal who had opinions about irregular schedules. I know, she said. He blinked. Aldrich Noman's extradition from Belgium was completed 5 weeks after his arrest. The federal charges against him ran to 11 counts, including conspiracy to commit espionage, unauthorized procurement of classified intelligence, obstruction of a federal investigation, and conspiracy to commit assault against a protected witness. That last charge stemming from the Voss operation at the federal building and the phone call to Emily's cell, both of which had been documented and entered into the evidentiary record with forensic precision. His trial was not a short one. It was not clean. Federal trials of this complexity rarely were. There were motions and counter-motions and legal arguments that stretched across months, and the international dimensions of the buyer network required coordination across jurisdictions that moved at their own pace regardless of urgency. Emily was deposed once, in a federal building in a city 2 hours from Fairmont, in a room very similar to the one where she'd spoken with Mercer, by a prosecutor who asked good questions and knew exactly which answers mattered and which were background. She answered everything she knew. She was precise about what she'd observed and what she'd inferred and where the line between them was. She said, I don't know, when she didn't know, and I'm certain, when she was certain, and the prosecutor, who had done this for 20 years, told her afterward that she was the clearest witness he'd worked with in recent memory, which she took as a professional observation and not a compliment. Derek Lawson pleaded guilty to 4 of the 7 charges against him 6 months into the process as part of a cooperation agreement that required him to testify against Noman and provide a full accounting of his relationship with the Callaway network. The guilty plea was entered in a federal court in Fairmont on a Wednesday morning and was public record by noon. Emily was working a shift. She found out from Jenna, who'd been checking the court docket on her phone every hour since 9 a.m., and who came to find Emily at bed 4 where she was explaining a medication change to a 67-year-old named Harriet, who had questions about every item on her discharge paperwork, which was her right. "It happened," Jenna said from the doorway, quietly, but not quietly enough. 2 minutes, Emily said. She finished with Harriet, who had one more question about the medication timing that Emily answered, and then one more after that which Emily also answered. And then Harriet thanked her in the specific, sincere way of someone who had felt genuinely heard, which was the whole point. Emily walked out to the hallway. "Guilty," Jenna said. 4 counts. He's cooperating." Emily nodded. Jenna looked at her, waiting for something, a reaction, an exhale, the visible release of something that had been held. "Is that it? Is that enough?" "It's what the legal process produces," Emily said. "Yeah, it's enough. It doesn't feel, I don't know. I thought it would feel bigger." Emily thought about that. "It doesn't feel big because the big thing already happened," she said. "The day it happened was Monday morning 3 months ago in the ER. Lawson decided what I was. He was wrong, and everything that came after was the consequence of that mistake." She looked at Jenna steadily. "The plea is just this paperwork." Jenna considered this. "What was the big thing exactly?" "That he underestimated me," Emily said, "and I let him. And then the situation required something from me that he decided I didn't have, and I had it. And after that, there was nothing he could do to put the picture back the way he'd drawn it." Jenna was quiet for a moment. "That sounds like you're saying the victory was being underestimated." "I'm saying the underestimation was the only mistake that mattered, his and everyone else's." She paused. "People look at what's visible and decide they know what they're looking at. They miss what's underneath because they stopped looking when they got a category they were comfortable with. Nurse, woman, quiet, follows orders." She looked at Jenna. "You're 25. People are going to do that to you for the next decade at minimum, maybe longer. What you decide to do with the gap between what they think you are and what you actually are, that's where everything happens." Jenna blinked. I wasn't expecting that." "Go chart your 1,400 meds," Emily said. "You're 7 minutes late." Jenna went, with the slightly stunned look of someone who had been handed something they needed to sit with, which was probably the right response. On a Thursday morning in early spring, 4 months after the events at Riverside Memorial, Emily ran the estuary route in the pale light before the city properly woke up. The federal tape was gone from the Port District facility. The building had been seized and was in the slow process of being processed through an asset forfeiture procedure that would take most of the year. It looked, from the road, like an ordinary abandoned industrial building. Like nothing had ever happened there. She ran past it without stopping. At the hospital that afternoon, she took a call from Ferris that lasted 12 minutes and involved a consultation request from a trauma surgeon who was working with a forward operating unit in a region she recognized by its description without needing the name. The consultation was medical, specific, and solvable. She solved it over the phone, talking through the procedure with the precision of someone who had done it and knew exactly which parts were the ones that went wrong if you didn't pay attention to them. When she was done, she went back to her patients. Bed 3 was a woman named Gloria, 52, who had come in with what she'd described as indigestion and which was not indigestion. Emily sat with her while they waited for the cardiology consult and explained what was happening in the clear, unhurried way that she used when someone was frightened and needed information more than reassurance. Gloria held her hand at one point, not in the way of someone clinging, but in the way of someone who needed to feel that they were connected to another person in the room. Emily let her. She stayed until the cardiologist arrived, and when she left, she told Gloria that she'd done the right thing by coming in. "My daughter told me not to bother," Gloria said. "She said it was probably just stress." "Your instinct was right," Emily said. "You listened to it." "I almost didn't." "But you did," Emily said. "That's what matters." She meant it as a clinical observation about the value of acting on a symptom that was real, even when it didn't feel serious. But Gloria nodded at it like it meant something larger, and Emily thought on her way back to the station that maybe that was the thing about clinical truth. It had the same shape as the other kind sometimes, if you held it the right way. That evening, she sat in her car in the parking garage for a few minutes before starting the engine. Not the shaking hands from before, just stillness. The ordinary, recoverable stillness of someone at the end of a full day in a job that was full of things that mattered. She thought about what she was now, in relation to what she'd been on Monday morning 3 months ago. The paperwork said she was an ER nurse at Riverside Memorial with a commendation notation in her federal personnel file and a part-time civilian liaison role that didn't appear on any public document and never would. The practical reality was that she was the same person she'd been before Lawson walked through the ambulance bay doors. Before any of it. She had not become something new. She had been seen more clearly, which was a different thing. She had known, always, what she was capable of. She had chosen to keep it quiet, to move through a civilian life in the dimensions that life required, to be Emily Carter, the ER nurse, and nothing more visible than that. She had thought of it as a kind of retirement. She understood now that it had never really been retirement. It had been dormancy, the way a skill remains a skill even when it isn't being used, the way a body holds its training even when the training isn't being asked for. She had been ready the whole time. She had just been waiting for a situation that required it. The situation had arrived in the form of a man who thought she was nothing. She started the car. There was something almost precise about that. The way the thing that was supposed to diminish her had instead been the mechanism that revealed her. Lawson had come into the ER with a badge and a voice and 20 years of authority and the deep, comfortable certainty that he knew exactly what he was dealing with. That certainty had been his operating assumption and his blind spot, and ultimately his undoing, all at once. He had looked at Emily Carter and seen the category and stopped there. And in stopping there, he had made a mistake so fundamental that all his subsequent moves, the complaint, the warrant, the late-night return with 2 officers and a document, had been built on it. And when the foundation cracked, everything built on it cracked with it. She drove home through streets that were doing the early evening thing. Commuters, dog walkers, the Thai place on Callaway Street with its lights on and its door propped open the way it was when the kitchen was running hot. She stopped and got food because she was hungry, and she'd thought about it all afternoon, and she sat in her apartment and ate it and fed Rook his dinner and sat for a while in the particular quiet of a day that had been full and was now over. The most dangerous person in the room is often the one who has nothing left to prove. She hadn't said those words to anyone. They'd lived in her somewhere, in the part of her that had processed the whole sequence and arrived at the truth underneath it. She had spent 4 years in this city being unremarkable, being functional, being exactly as visible as the situation required and no more. She had thought of it sometimes as diminishment, the narrowing of a large life into smaller dimensions. She understood now that it had been something else. It had been the specific, quietly powerful choice of someone who knew what they were capable of and chose when and how to use it, rather than leading with it, performing it, demanding to be seen for it. You could be the loudest person in the room and still miss the person who was going to matter most when things went wrong. You could have a badge and a decade of certainty and still fundamentally misread the situation you were standing in. You could look at a woman in scrubs and see a category and stop there, and that stopping, that comfortable, unexamined stopping, could be the thing that brought everything down on you. She didn't think about it as victory, exactly. Victory implied a contest, and she hadn't been in a contest with Lawson. She had been doing her job. He had tried to make that a problem. The problem had revealed itself to be his. She thought about Gloria's daughter, who had told her not to bother. She thought about Jenna, who hadn't spoken up on Monday morning and had spent the rest of the week making it right in the ways available to her. She thought about Marcus, who had handed her the chart like it was just another shift because he understood that some people needed to be treated as normal to stay effective. She thought about Patrick at the desk, who had pulled up forms with slow and deliberate hands because he'd understood without being told that slow was what the situation needed. People did what they could with what they understood. Most of them were trying. The ones who weren't, the Lawsons and Nomans, the people who built their certainty on the incapacity of others, they were a specific kind of problem, and they were addressable, but they were not the only story in the room. They never had been. She finished her food. She washed the container. She sat for a while with Rook on the couch while the city did its evening things outside the window, and she thought about the liaison role and what it would require and whether she had the reserves for it alongside the job she already had. She thought it probably asked more than she'd agreed to and less than she was capable of, which meant the balance was workable. She thought about Danny Reyes in physical therapy, doing the slow, daily, unglamorous work of recovering. About Torres being annoying about follow-up care in a good way. About a 20-year-old in 6 months who would not know any of what had happened and would come through an ambulance bay door and need someone who knew what to do. She would be there. That was the thing about choosing to stay. You had to keep choosing it. Every shift, every patient, every Monday morning when someone walked in with a badge and a certainty and a wrong idea about who was standing in front of them. The choice wasn't made once. It was made in every small decision that accumulated into a life, into a record, into the kind of person you were on the day it mattered. Emily Carter had made that choice before she ever took the job at Riverside Memorial. She made it again now, in the quiet of her apartment, in the ordinary darkness of a spring evening in a city that didn't know her name. She would make it again tomorrow. That was enough. That had always been enough. The most powerful thing a person can carry is the knowledge of who they are, especially in the rooms where no one else knows it yet. You don't have to announce it. You don't have to prove it. You just have to be it, completely and without apology, and wait for the moment when the situation finally asks the right question. Because when it does, the answer is already there. It has always been there. You just have to be willing to give it.